Hi, everybody, and welcome to our very first IAMT Advanced Training. We'd like to welcome Daniela and Victor, Francine, Dana, and Monique. And we are today going to be going through some really interesting concepts. And we're going to go through kind of some basics, too, because this particular session is review, with a few little extra things sprinkled in. We have got a model on Francine's side, which is who is going to have a full body study. So we're going to be going through the imaging step by step so that you can see. And Francine is a very skilled and experienced thermographer, so this is going to be a real treat. Okay. First, though, I would like to share with you some information about color. And when I started to think about what was so important, and I even called up Dr. Carol and interviewed her and asked her what she thought was the most important thing. She and I both agree that color is very important. It's probably, we know that focus is essential to a good imaging. But you guys are all experienced thermographers. This is not day one of class. This is advanced training. So why is color so important? Let's talk. All right, I'm just going to share something with you here. Here we go. And then we're going to practice on our model, paying attention to the things that we're learning now, okay? The first thing we want to do is talk about what color is and what color isn't. And where that becomes important is in what we understand that color is made of. What is color made of? So thermographically speaking, what is color made of? Does anybody want to take a stab at my mystical question there?
You mean temperatures?
Right. It's not so mystical when you think of it that way, right?
No.
Okay. Now here's the question for you. Is the camera a thermometer? I'm just going to find something here. Is the camera a thermometer? Anybody want to take a stab at the yes or no answer?
I think no.
Okay.
No.
Anybody else? No? Do we have Monique? Are you going to say yes or no?
I say yes.
You're going to say yes? Okay. All right. The camera is not a thermometer.
Okay.
The camera is very good at measuring what?
Temperatures.
Temperature.
The emissivity. You mean the emissivity?
Good. Emissivity. Yes.
Emissivity?
Yes.
Right. Very good. It's great at that. Now I want you to hold on to that question in your head. And we're going to go through this presentation, and at the end, we're going to answer that question, okay?
Okay.
So let's talk about color. We're jumping right in here. We're not wasting any time. Here comes color, everybody. Okay, so understanding the role of color in imaging. Colors are an aid to visually experience temperature differential. Okay, visually experience it. We know what our palette is that we image in. Daniela and Victor, do you image in color?
Yes.
Yeah.
Okay, good. Do you use this rainbow palette where green is neutral, red is hot, blue is cold? Good.
Yes.
Okay.
Yes.
Great. And I know everybody else does because you're using total vision. So the rainbow palette is pretty intuitive, right? We explain it to our clients and they get it right away. Each study in each region of the body is thermally unique. Isn't that the truth? I mean, don't we all know little tips and tricks about different regions of the body when it comes to color? We may learn some more today. When we change the color, are we changing the person's actual temperature?
No.
Is that not scientifically impossible? Right? Defies all the laws of physics. Imagine if you could just click a button and watch your client go, woo, it's getting warm in here. But you know, sometimes people just think that. You wouldn't believe what people think when they first are in my classroom as brand new thermographers. Okay? The colors are for the client, and this is super important. Everybody knows the colors are for the client, but we're going to tell you why in a big way here. First of all, we're looking at Total Vision software. What is this? Who wants to tell me what this is?
The temperature range.
Okay. And what do we call it?
We call it
And I can tell you what we call it in English.
yeah, what do you call it in English?
A palette bar.
A palette bar.
A palette bar.
Mhm.
Okay. And let me get the spelling just right. So we're going to call it the palette bar. Okay. Who wants to tell me what this palette bar is indicating here? What is it indicating?
The range of temperatures.
Good. It is a range. Okay.
Is the range that the sensor is detecting.
Very good. Excellent. So, Monique, I'm going to ask you to fill in the blank here. Everything 27.2 and colder will show up as
Cold and warmer.
everything 27.2 and colder will show up as what color?
Oh, colder, more blue, green, yellow.
So that would be everything 27.2 and hotter. Everything 27.2 and warmer will show up as different colors. Everything 27.2 and colder, or 26.2, 25.2, is going to show up black.
Yeah.
Okay. So now, Dana, can you hear us? Everything 35.2 and hotter is going to show up as. So right down here at the bottom of the palette bar, everything 35.2 and hotter is going to show up as what?
Red, as red.
As white.
Always white, yes.
As white. Okay. So what we're doing here is in between the black, which gives us no information, and in between the white, which gives us no information, right? We get nothing. If we go ahead and click up here, we're going to have a completely black screen. We don't see our model at all. When we're down here, we click on 35.2, we see white, we have no information at all. So everything in between these two numbers Celsius is our pattern, is our range. So this is the palette bar. This is the range. It's an 8 range. And everything in between these two numbers is creating pattern. Am I right?
Yes.
Everybody feel like that has sunk in. Is that sunk?
Yes.
Okay, we're sunk. All right. We're going to go through this basic because you guys know this. I just want to review for a minute, okay? Why is it important? Here is an image of someone that is colored properly, okay? Down here, what do we got?
Too hot, red.
Too hot. Over here, we got
Too cold.
too cold, all right?
What do you mean?
Okay, so too hot, too cold, just right, okay?
Mm-hmm.
Why is it important that we not save it like this?
Well, you said it already. Scares the
Yep.
client.
Scares the client.
Yeah, but you don't see any.
And the most important thing is it doesn't match the interpretation.
Yeah.
Same thing here. Scares the client. Okay, so this is review. I know you guys know this, but I just want it to sink in for a good reason. Okay?
Yeah.
All right. Here we are again. Too hot, too cold, just right. Okay?
But can I ask you something?
Sure.
The picture back, I see the eyes, the white spot near the eyes,
Uh-huh.
and I don't see them at the first picture, and I do see them at the second picture, the too hot picture.
So
we
mhm.
we look and we style it off. We
Adjust it.
adjust it at the white spots near to the eyes.
Well, not always, but it's a good guide. First white
Yeah,
pixels
okay.
in the inner canthus of the eye are a good guide. They are. They're not absolute, but they're a good guide. Yeah.
Okay. Oh, they're
So-
not absolute. So if you think this is, for instance, I keep the white spots and I see this is really a scary picture.
Yep.
I put it somewhat lighter or what warmer, no, what warmer, what cooler.
Colder. Yeah.
Like the
I think
But that-
I think the answer to your question is it's okay to get rid of most of the white or all of the white if that's what you need to do.
Okay, if it, yeah, and then you go on. So you go to the breast and etc. And the color will not be the same as at the first picture.
Good. Yep, that's true.
Yeah. So how do you do it at the rest? At the rest of the body, I mean, because you in the range you take another number.
Correct.
Because you want to make better look pictures at the first. Do you understand what I say?
I'm not quite catching it.
No, Monique,
Because-
every section has its own temperature range.
Yes.
So
I
the
know.
head range is different than the breast or the abdomen or whatever. So you need to adjust it for every
Okay.
section.
Okay, then I get it.
Then so what this does is it brings up a good point. In general, the head is the hottest part of the body. Specifically, the anterior head is generally, in a normal person without injuries or issues, the head is the hottest part. And so as we move down the body and it gets cooler as we move down the body, we have to continue to increase our temperature range to bring out pattern. Okay. All right. So let's move down here. So by the time we get down here, if we left it in the same range as the head, it would be way too cold. We have to heat it up. Okay. Even the breasts usually. Okay. Let me just go here. We use color to bring out pattern. That's our job. That's who we are. We are pattern hunters. And proper color intensity brings them out. Okay. So here comes the question. What creates a pattern? Anybody want to take a stab at what creates a pattern?
Inflammation creates a pattern.
Okay, good.
Congestion creates a pattern.
Inflammation.
Okay.
Yeah.
But what creates the thermographic pattern that shows up here on these images?
The program.
It would be the heat beneath the skin, and that will radiate to the skin, and that is going to show in the thermometer.
Excellent answers, all of you. I'm going to give you the one that you're going to be like, oh, of course. What creates the pattern is temperature differentials, right? That creates the pattern, temperature differentials, right? So keep that in mind as we go through this. temperature differentials create the pattern. Obviously, the temperature differentials are because of the inflammation, like Dana said, because of the heat, like Victor said. But it's actually the difference between this white hot knee and this bluish green area here that creates that pattern. And when that pattern is created, our doctors have something to grab onto. So when it comes to patterns, what are physicians looking for?
Asymmetry.
Bingo. Perfect answer. They're looking for asymmetry. And here's two examples here of asymmetry. And here's an example here of a pattern that isn't normal. And here's an example of slight asymmetry. And they're looking for all of that.
Mhm.
Now, I had a little interview with Dr. Carol, and I asked her about that. And I asked her, I said, you guys are looking for asymmetry. I know why you're looking for asymmetry, but let's go deeper on why you're looking for asymmetry. Does anybody want to take a crazy stab at what she said was the most important thing to interpreting physicians? And it has to do with the FDA, and it has to do with the rules that we all have to follow. Anybody want to take a little stab at that? It's a far out answer.
It's a what?
It's a crazy answer. It's an answer I never, you know it on some level, but what interpreting physicians are looking for is they are looking for a reason to recommend further clinical correlation.
Oh, yeah.
Right?
I was thinking of something else. Yeah, sure.
Yeah. Yep. Because they're thinking about the rules they have to follow. They're thinking about the health of this client, of your client that you care about, and they care too. And so if we don't have a pattern that's properly measurable, because we did not take the image right, frame, focus, color, all the things we're supposed to do right, they may not be able to properly recommend that further clinical correlation. Here's an example. This lady right here, the breasts right here, has a pattern over here, right? And it's asymmetrical, which makes it even more significant, right? So the significant levels keep going up.
Mhm.
Not only is it a pattern, but it's also a pattern that measures greater than 1.5 degrees Celsius temperature differential, and that's what they're looking for. They're looking for 1.5 degrees Celsius temperature differential or more. On the other side, we've got a colder breast, so now temperature differentials across both breasts are different. And so this would be considered significant. If we don't take the images correctly for them, they may not be able to properly interpret this and put out that level of significance and advise them to seek further clinical correlation. We want them to go to their doctors. We want them to follow up. It's important. The one thing that is very important to thermography interpreting physicians, thermologists, is that they want to make sure that they have the health of the patient in mind, the client in mind. So what if somebody if the thermographer and the interpreting physician, she didn't take it right, the interpreting physician wasn't able to really interpret this well, and did not say that this level of significance is high enough to seek further clinical correlation. Then the lady doesn't do anything about it. She's like, oh, I must be fine. And then 2 months later, she has a routine mammogram and they find cancer or they find something significant. And she comes back to you as the thermographer and says, you steered me wrong. You didn't, nothing, it said nothing in the report. So Our thermologists, our interpreting physicians, are not looking to diagnose anything, but if there's something that's thermographically significant, they want to be able to catch it, and they want to be able to recommend further investigation. Make sense?
Yes.
So the
Yeah.
most important thing to our thermologists is that they are accurately getting images from you so that they can accurately evaluate temperature differentials and accurately recommend, accurately assess significance so that they can recommend that these people go seek investigation. Does that make sense?
Yes, absolutely.
Okay, all right.
So Kristin, can you please share the former slides before this one?
This one?
No, one before that.
Here.
Oh, the one before that. The one before this one.
Right.
This one.
Mhm.
Yeah.
Yep.
I mean, this one is so obvious to miss if you have the images too cold.
You bet. And if you have the images too cold, the interpreting physician can still change the images. They will still probably hunt out this pattern for you, but you've made it very difficult for them. And the interpretation, where they're going to call this significant because of its shape, because of the asymmetry, because of the temperature differential, all of the above, and you didn't give them the right image, so now the client says, that doesn't look like anything, I'm not going to my doctor. They're just trying to sell me something. She's probably getting a kickback from the doctor she told me to go to, something like that. You know how people think. So you want to make sure that you properly color these images. And I'm going to show you a couple of tricks on how to do that. And we're going to go ahead and make sure we start imaging our model so she doesn't freeze to death over there. One of the most important things that we want you to see and talk about too, that you probably are missing, is visible veins. This is the same person here, okay? Always ask if they have any visible veins on the surface of their skin. If you can see the blue veins, they're about a 1/4 inch below the skin surface. If you can see them, they're about a 1/4 inch below the skin surface. If you don't ask if they have any visible veins, or if you don't ask to personally inspect their breasts, or hold up a mirror and just give them a mirror and have them look, because a lot of times they don't know. They've never noticed their veins on their breasts, so they thought it was normal. You can go ahead and visually inspect that, or have them inspect, say, yeah, I have little blue roads all over my breasts. Look at this image here of these veins here. You see this? These are visible veins, and this is the exact same person. This person has looked like this since 2006. This visible vein actually comes and wraps around the nipple as well. You can see it visually. So the point is if you can see it, it's not as significant. If you don't point out visual veins, the interpreting physicians are going to constantly be calling this out, and they're going to constantly be recommending further investigation. Okay, so it's very important to make sure that you talk about, ask questions about, and have the client tell you, or you walk around back there and say, hey, may I please take a visual inspection of your breast? You do it very professionally, and you do it, you do it with all the, professionalism that you have, and you just look. And then you can go ahead and put an arrow on that with your software, and we'll talk about that a little bit later. What other things can you ask about? If you see something on the surface of the skin that looks asymmetrical to you, or something that is unusual, what kind of questions can you ask?
If there's sorry.
No, go ahead. Go ahead, Danielle.
Thank you. If there's a pimple, I don't know the exact word in English, but
Sure.
like a dark spot on the mole in the skin. On the skin.
Good. All kinds of things cause unusual looking patterns on the skin, right? Bug bites, moles, you know, temporary things like they bumped into something. So it's important to ask those questions too when you see asymmetry without alarming them. Okay. Important when it comes to color is the follow-up imaging. The follow-up imaging is absolutely essential to take properly, and it's more difficult to take properly. Why? Or it can be more difficult. Because what do you have to do?
The temperature.
Maybe the room is colder or hotter and you have to adjust that.
Good. What are we looking at right here? What is this and what is this? For those of you who are using total vision, what is this and what is this? Monique,
With and without. Oh yeah, go ahead, Monique.
Monique, you know what this is?
The head.
Nope, this whole screen right here.
What is
So look at the difference here over this on the side. This is the stack.
You have here a layover and there you don't have it. Is that
I
the
didn't hear you.
difference?
Are you on a different microphone than you were when we were last week together, Monique?
No, this is no, I'm on,
Okay.
on my laptop.
We're getting kind of an echo from you. We're getting kind of an echo. Okay, so this is viewer and this is total vision. Okay, this is how you capture the images and this is how you look at them. For those of you who have total vision, viewer, you can change viewer all you want, but it won't stay. For capture, you can change it and it will stay. Okay, and then it'll show up in viewer as being changed.
Okay.
So here's the thing. This girl comes back to us in 3 months to get her follow-up imaging, and a professional thermographer is going to pull up her previous images on viewer. You're going to pull up the previous images and you're going to strive to take them the same. When you can't, then you know what? Let's say that she's been working on this pattern up here. And I left this hot, by the way, on purpose. We're going to look at this later. But you're going to, she's been working on her sinuses with her physician. So what you're going to do is you're going to pull this up, the previous image from, let's say this is January and this is April. This is January, and now she's sitting in front of you in April.
Mm-hmm.
Why is it so important that you take April's imaging correctly? Why is it so important?
Otherwise, you don't have a good vergelijking.
Good.
Comparison.
Because the interpreting physicians are going to know how to interpret that. And they're going to give you an interpretation that says she's better or worse or she stayed the same. If your images the second time around don't reflect that, then you're not taking professional images. Okay? So bring up her previous study. I'm not sure how you would do that, Daniela, with your software. Even if you have the report in front of you and you're just looking at the images previously on a piece of paper, strive to try to match them up. And when you can't, let's say her nose is still just as cold as it was before and her cheeks are the same, but all of a sudden you look and this is lighter. Wow, whatever she's been doing is working, right?
Yeah.
But if you don't look at the other images and you don't strive to take them the same, you're going to get in trouble. Now let's go back to our palette bar. Is it okay to just go ahead and match it up to 27.2?
No.
Good. Good. There are
No, it
some
has
people that think it's okay.
No, you have to visual. Make a comparison, visual.
Right. Why is that, Francine?
Well, if you go to the exact same temperature, it might be that it's completely blue, black, whatever.
You bet.
I mean, yeah.
Because the temperature of the day and where the person is today can change greatly between January and April. January, it's cold, and April, it's warmer. The room may be warmer, but what will stay absolute? What will stay absolute?
Their own temperature.
Patterns.
The what?
Their own temperature, you mean?
Nope. What will
No.
stay absolute?
Um,
The temperature differential.
Hmm.
The temperature differential will be absolute. So back in January, the difference between this hot spot and the normal green was 1.6. Okay?
Mhm.
And now the difference is 0.9.
Okay.
So you know that she's getting better. The temperature differential is what tells us what's going on, not the way you set the color. Does that
no.
make sense?
No.
Yeah.
Okay. Okay.
So,
let me-
Kristin, just to make this right, you're
Yep.
not going to compare it, your patterns or matching your temperatures. You're going to see the asymmetry to know that your patient is getting better. Is that right?
Well, our interpreting physicians are going to evaluate symmetry. They're going to evaluate temperature differentials. See, they have special software that does that. We don't. We have some rudimentary software that can help you, but they're looking at it with different palettes. They're measuring it different than we are. So let's say that this is January and this is April. And let's say she's better here. She's lighter here. Okay. And you've matched up the nose and you've made sure that all the things that can be the same are the same. And I'll repeat that. Make sure that everything that can be the same is the same. Maybe hair, maybe the nose and the cheeks. Cool them off. Make them look like the other image. And then see if this has really changed. Okay. Now, there's a way to do that. Let me show you here. Okay. On Total Vision, we can actually do a quick measurement to figure that out. So I'm going to go back to my very first question, then we're going to start imaging. Can we claim that the thermography camera is a thermometer?
Nee, dat kunnen we niet. No.
No.
But
What can we claim?
yeah, you can measure. It shows when you go with your dinges to that puntje. You can see the temperature on the head, for instance, if you go with the arrow or with the.
So what we can claim is that the temperature differential is absolute. We cannot claim that the temperature is absolute. So if we put our cursor here and it says 30.88 up here, we can't claim that that actual pixel is 30.88 degrees Celsius. But what we can claim, and what the FDA in the United States allows us to say, is that the difference between the coldest part of this circle and the hottest part of this circle is 1.6 degrees Celsius. That we can claim. Does that make sense?
Yeah.
So what we can do with this software is we can go up here, we can grab an ellipse, and we can draw a circle around it. As long as it's red or green, we can draw the circle. When we draw the circle, the coldest part of the circle and the hottest part of the circle will be recorded down here as minimum and maximum. The difference, this little delta T at 1.6, is the temperature differential. And that we can claim. Okay? That we can claim. And if it is greater than 1.5, it has earned its red. So if it's greater than 1.5, it has earned the color red. So if you are ever interested, and we're going to practice this a little bit, Francine, we're about to get started. If we ever have a question like, really, should that be red or not? I don't know. Maybe I should make it more yellow like this one. Or maybe maybe it should be even redder. How can I tell? You can draw a circle around it using your ellipse in either green or red. And down here, it will give you the temperature differential. Okay. Now that is that's the way here comes Dana again. Whoops. This is a very rudimentary way of doing it. Our interpreting physicians use a very sophisticated palette system and other ways to measure. But this right here, drawing these circles can help you if you do it right. So what we're going to do is once Francine starts imaging, she's going to demonstrate that for us, okay? So I'm going to stop sharing, and we have a model here that's ready. What is your model's name again, Francine?
Mika.
Mika.
Mika, yeah.
Mika. Okay.
Mika is from Belgium.
From Belgium, okay.
She came all the way here.
How nice. Okay, thank you for waiting, because I wanted to go over those concepts before we started imaging. So I appreciate Mika waiting. Yeah. Okay, sweet. So you're going to share your screen with us, not just your software, but your whole screen.
Yeah. Let me do that again, because I want to make my software a bit larger. And
it was large for us, at least that's what I could see.
Yeah, but I want to have it large for me as well. So
sure.
Like this. Let's see again.
Dana, can you see us? Okay.
Okay, here we go. Okay.
Awesome.
Everyone can see it. Yeah. So.
Okay, looks good. All right. Oh, wow. We're in Dutch.
Absolutely.
Whoop, whoop. Okay.
Yeah. Okay. So, I will speak in English because she understands the English.
Okay, good.
But I will give the instructions now. So, would you please come over? I will have this one out of the way because. Okay. So, I want to ask you to keep your hands on your hips like this. Okay. And try to keep them like this for as long as you can, or as long as I want you to do this. We start with the head imaging, and for the head imaging, it's very important that you open your eyes, close the mouth, no smiling, and just look straight in the camera, okay? So I will go back and forth to you. So we're doing live imaging, as you know. That's our that's the way we do it in Europe.
You mean you're right in front of her, you're not private?
No, I'm not private. I can see her. There's no curtain, no screen.
Okay.
And so we're used to that. So in the history, I took all the history already. And in the history, there is a part where it says varicose of veins, you know. And I was right in front of her, and I looked at the veins on the breast. So I know where they are, and I make a description in the history where they are.
Okay, good. That's excellent.
Yeah, that's
good. So now she's probably getting the camera about 35 inches away.
Yeah. Here we go. I need to have my camera exactly horizontal, like this. Yeah. And
good.
Echt in de camera kijken. Here you go. Okay.
Daniela and Victor, do you have overlays?
No, we don't.
Okay. I'm going to be talking about overlays. So
even open houden. Let me adjust the color just a little bit.
But we
Recht
follow
in de
a
camera
protocol.
kijken.
Okay,
good.
And that's how we get the images right.
So I noticed that she doesn't have a band on her head, so she has hair hanging down.
Yeah, a little bit.
One of the things that is important is to use a band to smooth the hair back, or to make sure that we got bobby pins, something that takes the hair off the neck and from in front of the ear. In front of the ear is a pet peeve of some of the interpreting physicians I use, because it can block out the TMJ joint.
Okay, yeah.
So maybe is that a little piece of hair in front of her ear?
Yes, it is.
There we go.
Yeah, that's better. Oké. Je mag de kin een klein beetje optillen. Heel klein tikkie. Ja, dat is oké.
Now, one of the things, make sure that you use your Zoom too, so that she's just right in this overlay.
Oh ja.
We have overlays that help us fit the person in so that they're identical each and every time. And the reason why we do that is for consistency over time. Now, so we got lots of hair on the neck there. So you don't use a band, Francine?
Sometimes it warms up, this band. I have these little clips. I have thousands of little clips, but I forgot to take them with me today. So
Okay, it's all right. No worries.
And
And since you're the interpreting physician on this one, you're going to see what you're going to see.
Ja, oké. Oké, even vasthouden. Let me see. Gonna give it a bit more focus, like this. Ja, oké. Dan mag je naar mij toe draaien. Ja, dan til je de kin op. Naar boven. Dus de hele kin op tillen. Ja. That's right, here you go.
And when we take the thyroid, it's important that we have them lift their chin. It's also important that we don't, sorry, I just got something in my throat here. It's also important that we don't adjust the color according to the head.
Okay, so
Thyroid
we
can
keep the
be
same
different.
color. Yeah, okay, so we keep the same color as the head.
Sometimes it works for the same color and sometimes it doesn't.
Ja, je mag een klein tikkeltje naar links. Een klein beetje maar. En dan hetzelfde houden, dus je kijkt weer naar boven. Ja, precies.
Now, one thing about the thyroid image is that you need to be able to see across the opposite cheek. So you see that opposite cheek there. If you turn her a little bit more to her right, which I know you will, I'm just throwing it out there. The opposite cheek is something for positioning.
En dan, en dan het hele lichaam. Alleen dit doen, hè, maar inderdaad hoofdrecht op het lichaam. Kijk nog eens naar boven. Ja, en dan draai je nog een tikkeltje naar links. Oké, like this, Kristin?
Yeah, not bad. Are you using the automated stand?
No.
Okay.
I have my my hand.
Okay, gotcha.
So look at my stand. This is my stand. You
Yeah. Okay. Yep.
So I'm moving up and down.
You're moving it up and down and side to side. Yep.
Okay.
And Monique, does Monique have the same setup?
Yes.
Yes.
Exactly.
Okay.
Yes.
And how about you, Daniela and Victor? Do you have an automated stand or do you hand operate your stand?
It's hand operated, the stand.
Hand operated. Okay. Gotcha.
En dan mag je de
So
kin
we'll
een
talk
beetje
about
naar
it. I
boven
used a
doen.
hand operated stand for years. But then my last 5 years of owning my business, I had the automated stand. And of course, it's wonderful. So you move the camera so you stay at 110%. Am I right, Francine?
Yes, I always keep it at 110%.
Okay. So you don't use your Zoom very much.
No, hardly. So how about
Interesting.
this?
So it's different when you image with an automated stand, you use your Zoom all the time.
Recht doorkijken.
You don't ever touch your camera. Dana, do you have an automated stand?
I have an automated stand and it's still a manual stand for emergencies.
Okay. So you're using automated up and
So-
down as well as pan and tilt? Okay.
Yeah.
Now
Okay.
I'm going to adjust the colors a bit.
Good.
Because
Okay.
otherwise it would be too cold.
So
Probeer de schouders te laten hangen. Laat de schouders zoveel mogelijk hangen.
she's in a good position
Yeah.
right now, but do you mind demonstrating your Zoom for us?
Oh, yeah.
Zoom a little closer,
Okay, I will.
Yeah. just to show them what it does. Okay, so I'm not sure, Daniela, do you guys use a Zoom function or do you just move your camera closer and farther?
we move the camera closer.
No zoom. Okay. Zoom is helpful because you don't have to refocus, right?
Okay.
It's an optical zoom, so there's no refocus necessary.
Okay.
Like on your Francine, when you do your breasts, do you use zoom more on the breasts because
Never
then you don't
use
have to get
zoom.
up?
No, I never use Zoom. I always, I'm used to just moving up and down with the camera.
Okay. Okay,
You can turn
interesting.
around.
Okay, so Francine, let's see if we can, because Francine, you're an interpreting physician, so
Yes.
you've been doing this a long time. But let's see if we can't use your Zoom a little bit
Yes.
more when we
Okay.
do, just for
Okay.
fun,
Yes.
just for fun.
Perfectly fine. Yes.
Okay, so here's a fun fact: does anybody know if the chest is part of the breast imaging?
No.
Yes.
No.
No, it's not.
It's not. It can be adjusted separately when it comes to color.
Mhm.
Now, as long as she's in a comfortable position, let's look at the scattered pattern on her upper chest. And when we talk about pattern, make sure that Micah does not, we're not talking about any specific pattern. We're just talking, okay? We don't want to scare her by saying pattern or anything like that. So we're looking at this pattern here, and it's important that we have it focused. Right now, it's not in focus, right? And she knows that. We know that. We want to make sure that we have a really good focus because there's always some pattern to look at. Now, when it comes to the difference, the temperature differential in patterns, oh, she's going into all the different palettes. There you go.
Okay.
So how are you going to adjust this color? How are you going to adjust this color, Francine?
I would say like this. No, I would say like this. What do you
Huh?
think?
So you're imaging the chest, not the breasts.
That's right.
So you chose to leave the breasts a little cooler. Now, here's one thing that I always say is when you see those lighter colors, like the lime green, that's just about to go yellow. I try to bring those patterns out a little more. So try to bring this pattern out just a touch more. Yeah.
Like this.
Okay. Just a touch more. It doesn't change anything.
Check with your
That's right.
appointments. You can just pull in and go see.
And I could see those veins visible on her breast.
Okay, good.
Those are just normal veins visible. Yep.
Okay.
Okay. I'm going to take this one. And then
Okay.
we move over to the breast. Okay.
Right.
Handen op het hoofd doen. En in plaats van zo te zitten, ga je.
One of the things about using the overlays is using is making sure that you're getting consistent images time after time after time, and the overlays make it very easy to do that. We also have these purple crosses here where Dr. Carroll says this is important. So you want to see a little bit of space up at the top of the shoulder. We call those the black triangles. So that's why there's a purple cross up there. And we want to see a little bit of space at the bottom of the breast. We don't want to cut off the breast. And that's why there were the purple crosses at the bottom. And when she turns her to the left, the purple cross goes on the edge of the chest. Now, here's where I think your Zoom might help you.
Yes. Okay. Let's do it.
Because if you center her in the middle of that, all you have to do is zoom closer.
Oh, yeah. Okay.
So she first has to be centered in the middle of the overlay. You see, you got extra back.
Yes, I see.
But once they're centered, your zoom keeps you from jumping up and down.
Okay.
You know what I'm saying?
Yeah. Okay.
I know it's different from what you do, but
That's okay. I'm here to learn extra other things.
if I could help you not, yeah.
Tunnel vision.
If I could help you save 3 jump ups for every region, because when I used to image, I never jumped out of my chair, ever stood up.
Hey,
So you're obviously getting a lot more exercise than I ever did,
absolutely.
but I used my Zoom to bring it all in.
Okay. Yeah.
Do you have the overlays that are anatomical overlays?
No, we don't. They took it out
Okay,
from
gotcha.
our software. Okay, so we're going to press op dit. Je mag eens dit.
So what we do here is we have you center them in the overlay. If you don't have overlay, center them as best you can, and then turn them into that line so that line is over the nipple. If you don't have the line, then you're looking for equal distance on both sides of the nipple.
Right. Okay.
Now we're talking about color today. How do you think Francine's doing with color here?
Good.
Yeah, good.
Yeah.
What she can do is she can take the images and then she can go change the color later, can't she?
Yes.
What
Yes.
can't she change? Once she takes the images, what can't she change?
Focus.
Focus, right? She cannot change focus. Obviously, we all know this, but sometimes we're so worried about the color, or we're so worried and we use Zoom all the time in my world, so we're worried about the Zoom, but really, that could all be changed later.
Ja, dat is fantastisch leuk. Oké, je mag de handen op het hoofd doen. En dan kijk je een klein beetje boven.
So what she did was she had her stand up, and now she's going underneath the breast. There's two reasons that make this a good idea. The first one is that she's cooling off her abdomen, because the abdomen is up next.
Yeah.
And it's important that it starts to cool off.
Okay. So
The second one is as when she stands up, you get a little bit of a better view underneath the breast. Although you can take this seated, which I usually
klein
I
beetje
did.
naar links draaien. Draai met je mee. Ja, misschien is dat al te veel. Even terug, ja. Dan ga je overhelden naar links. Ja, doe maar mee. Linkerarm gaat achter je.
Oh, oh my goodness.
Schouder recht, dan kijk je naar boven.
Okay.
Great. Here we go.
Okay. When we do this image, let me see if, okay. When we do this image, when Dr. Carol is interpreting, she wants to see all the way up and into the underarm.
Okay, so she wants to
there.
have it. She wants to have it like this.
Yeah. Do you mind trying it a different way, just for the sake of training? Have her put both hands behind her head.
Okay. Even beide handen.
Both hands behind her head. Okay, good. And she doesn't have to rock to the side. She can be straight. Okay. And now bring the camera closer to her or zoom in.
Huh? Doesn't she need to bend over to the left?
No.
Oh, okay.
We never ask them to bend.
Oh, okay.
And you can ask them to bend, but that's not the way Dr. Carol and I teach it.
Okay, so now we see the axilla.
Yep. This is how Dr. Carol likes to see it.
Oh, this is how you want it.
That's how Dr. Carol likes it. Now you're your own interpreting physician. I'm not going to tell you to do something that you're not comfortable with. I would zoom out to 100%, maybe zoom out to 105%.
I love you, Kristin. This is so amazing. I mean, isn't this just wonderful?
But this
I'm
is
doing
much
this now.
easier.
I think so.
It's much easier, I think.
7 years.
So zoom out to about 106.
Oh, yeah, I will zoom out. Hou je het nog even vol?
There you go, 104, 106. Refocus. See if you can get a little better focus there on that breast. It's tough.
Yeah.
That looks a little better, don't you think?
Let me see.
A little better. The opposite breast is out, but nah.
That's a bit
Now
out
see
of
if you
focus.
can tighten
right?
that focus up a little bit.
So, okay, this is better.
Yep.
Here we go.
All
Okay,
right, here we go. That's the way we like to see it. If that makes it easier on your clients.
Okay, thank you.
Mm-hmm.
So like this or a bit more. Is this oblique enough?
Yep, that's oblique enough. Maybe she could turn it a half inch to her left.
Yeah. Yeah.
Half inch. Just a teensy weensy bit, not even that much. It's just a twist. There it is.
Okay, thank you. Thank you. I love this.
Hey, hey.
Can you put your camera over the
Okay, ontspan maar even.
I would like to see if the camera on that shot was was tilted? Was it?
Oh, yeah.
Oh, look, yeah, look
It's
how the camera
tilted.
is.
Okay.
For the anteriors, we tilt. And our thermologists,
All the
our
way.
interpreting physicians say that the best image of the breast are these two inferiors right here. The oblique inferiors give our interpreting physicians the most information.
Okay.
So you've got the anterior, great. And then you've got the laterals and the obliques, but it's the inferior obliques that give our doctors the most information.
Great. Thank you.
Thank you.
You bet.
I will put it horizontal again and we start with the abdomen. Het is belangrijk dat je een klein beetje loslaat, inderdaad. Ja, dat is goed.
So Daniela and Victor, you don't have a zoom function on your camera at all?
Was?
Do you have a zoom function on your camera?
I'm not sure because we never use it. But,
You never use it. Okay.
I'm not sure if
Do you want it like this, Kristin?
I think she should take a big step towards the camera.
A big step
A
toward.
big step towards the camera,
Okay.
and then you're going to zoom out to about 110, maybe 112. There she is. And now you're going to move your camera so that the cross is over the navel.
Yes. But don't you want underneath the breast a bit in
Yes.
here?
Yep.
Okay.
So wait till the cross gets up to the navel before you make that decision.
Like
Mhm.
this?
Yep. That's how Dr. Carroll wants to see it.
Oké, en dan mag jij even recht over de camera, want anders krijg ik een twist hier in de buik. Ja, dus probeer over. I asked her to look straight over the camera because otherwise she will have a twist in the abdomen.
Gotcha.
And
Yeah.
then it looks like
So
she's having a
Francine, is there any way you can get your computer closer to your camera so you don't have to keep jumping up, or is that just good
Oh.
exercise?
Yes, it is good exercise for you.
Okay. And you see her right arm touching her body or looking like it's touching? Yep.
This is better. Here we
There
go.
you go. That's the image right there. Mhm.
Wat je doet is de armen zo.
Kristin, I do have a question. The male and
Yeah, when we're screening as males,
woman and man.
Yeah, the difference between the male and the female imaging.
Yeah.
is it we have to take the same breast images in both?
No. Nope, just three. Just anterior and two laterals for the men.
Okay, perfect.
Now, if you have a man with breast cancer or suspected breast cancer, I've only seen two in my entire career. Very odd to see a male breast cancer.
Very
But
odd.
Ja, sorry.
if you see that, I would recommend trying to take some obliques.
Probeer hem niet aan te raken. Ja.
Now, you don't need them to arch backwards because they don't have any breast tissue.
Yeah.
There's no globe of the breast.
Okay.
Now, see, you can zoom out here. You can zoom out here, for instance.
Oh, okay.
Look at
Because
this.
do you want to have the cross in the?
Right there. It can be, Carol likes it a little bit higher up. I liked it in the middle, but so if you did go up a little high, yep, right there.
Right there, huh?
Yep.
Okay.
And then you know how they sway. People sway.
Yes. Okay.
And that's why I'm wondering if you can be closer to your camera so that you're not jumping up all the time. But if you don't mind it, if you
No.
want to jump,
Keeps me fit.
okay, all right.
Je mag helemaal
I got a big butt doing my imaging because I never got up.
Another question. So in the lower shot of the breast, the patient must lean back.
They don't lean back so much. You can, it's a little bit of an arch. So if I'm just normal like this, I'm just gonna straighten up a little bit. And then the camera is tilting up underneath the breast. Now with women who have very pendulous breasts, and it's very difficult to see underneath their breasts, we have them hold them up with two fingers. So they just hike and arch back like this, just two fingers right on the areola above the nipple and hike. And we say 1, 2, 3, and quick take that image because they can't hold them up very long.
Okay.
Yeah.
How do you like
Okay.
this one? Or do you want this different? This one.
Let's, okay, so you can zoom into 110
Okay.
and then you would lift your camera up a little bit.
Uh-huh.
And then her hands are going to be flat. She's going to have her hands and her fingers spread apart a little bit and arms out from her body just a little bit more.
Yeah.
There she is.
Okay.
And you know, when we look at this one, the doctors are just looking for kind of an overall pattern
Uh-huh.
that may happen between the shoulders and the back. And this is where color negotiation comes in as well, where the top of the body is warmer than the bottom of the body. So you may have to negotiate the color. See what you just brought out in the SI joint there, the sacroiliac?
Uh-huh. Yes.
See what you just brought out?
Yeah. We go. Yeah.
Yeah.
And what, for me as an interpreter physician, I always want to see underneath the buttocks.
Yes.
If it's a bit, if there's a hypothermia there, it means it has something to do with the sacral spine.
Sure. Yeah, absolutely.
Maar niet over de...
Oh, you didn't take the picture yet, did you? You didn't capture the image yet.
Ja, precies. Een beetje tanga van maken, maar dan nog wel iets lager.
Oh, I see what you're doing.
En dan de beeldspleet, dus toch nog iets lager. Nee, dus...
God bless her.
Ik bedoel, is dit een klein beetje lager, maar wel tussen de billen houden. Dan zit het
There she goes.
Oh, here. Yeah, this wonderful. You see that? Ja, nou je ziet het. Oké, en dan de handen weer eventjes open naar de muur laten wijzen. Ja, oké. Fantastisch. Here we go. Oh, wacht even. Die is niet scherp. Andere kant op. Ik heb hem bijna.
There you go. Nice.
Yep. Omdraaien. Kom maar even de stap dichterbij.
Now, do you use Control R, Francine?
Control R? No. What's Control R?
Okay, good. We've got some things to do.
Yes, absolutely. Okay.
We got some things to learn.
Yeah.
Good.
Yeah. Okay.
Now, this one, you know, you may be tempted to look at the throat and say, oh, the throat is so hot, I have to change this. But remember, the doctors are just looking for patterns traveling up or down the body. Lymph patterns travel up from the abdomen up and then from the throat down. So it's okay to have that really hot throat.
Yes.
Okay.
Yeah. Okay, here we go.
Good.
Oké, nou, dan mag je de onderbroek helemaal zo omhoog doen. Ja.
Now, right from where they're standing, you just drop the camera down so you don't have to refocus or anything.
Dan doe je de handen zo. Want we gaan met de benen bezig en ik wil de handen niet bij de benen hebben. Dus je doet je handen zo. Vouw ze niet in elkaar. Because afterwards, we're going to image the hands, so don't warm them up. So keep them like this, okay? Here we go.
You can see how much colder the legs are because she hasn't changed. She hasn't changed. And I know we all know this, but just to point it out again, one of the things that Dr. Carroll said that a lot of thermographers do that she sees when she does interpretations is the groin area is hot, right? So you take that into consideration and you don't make the legs hot enough. In order to properly color the legs, you have to see some red in the shins, just a little bit like that. And ignore that groin area because you're never going to cool it off. Am I right? Okay.
Je rechtervoet zet je op. Rechtervoet erop. Oké, handen omhoog houden. Oké, doen we hetzelfde aan de andere kant. Dus je mag helemaal omdraaien. Dus kan. En dan de linkervoet.
She does a fast imaging. She's very efficient. And she's going to go back. We're going to go back together at the end of the imaging and we're going to color it.
Okay. Je mag je omdraaien. En dan kom je zeg maar op het einde van de mat staan. Dan ga je met de knieën. Yeah. Ze niet echt.
Did she complain of any knee issues, Francine?
No. Ja,
So would you ask the question based on what you see?
Ja. Heb je iets met je knie of gehad? Ja. She has no idea.
Does
She
she kneel?
wasn't sitting like this. I watched her.
Does she kneel for a living? Like, does she do something on her knees, or does she have a child, or
Wie ver op je knieën? She does sculpting. Sculpting.
sculpture?
Sculpture.
Sculpting, yeah.
And she kneels?
No.
No.
Okay. So it's unusual to see kneecaps that aren't cold. So
Absolutely.
yes, here's the
Absolutely.
question. Yeah.
Yes, absolutely.
I have
And we-
been my knees over the weekend with a little child.
Oh.
Friend, but is that,
Yeah,
can it
could
be
be.
so long?
Okay, can be. She over the weekend she has had a child around her. She's been on her knees,
Ah,
and it's very unusual for her.
well, it's symmetrical. At least it's symmetrical.
Kan wel omdraaien, dus met je rug naar de kamer. Zo. Mhm.
Ja, die zit het ook.
Okay, while we're doing this, while
Does her
she's,
knees crackle?
Als je daar kan staan.
oh, her knees crackle. Okay.
Ongeveer zo naast elkaar neer. En dan niet meer verschuiven. Dus zet je voeten maar neer. Going to step forward. And she's going to put her feet next to each other. And I told her not to move her feet anymore because it will leave heat marks on the floor.
Right?
So we're going to skip the plantar feet. We're going to skip that one, save it for last.
Good.
Always save the best for last.
Yes, the best for last. They get to sit with their feet up.
Here's the toes. So the
There's
toes
the
are in.
toes.
Toes are in. So how about the color? What do you think?
What I do is and this is the way to do it, is to bring out the asymmetry, because oftentimes, very often, you'll see an asymmetry on the dorsal foot, which is what we're looking at right now.
Yes,
Most people lean one way or to the other. They're compensating. So you can see that her left foot has a pattern that is asymmetrical with the other side in terms of temperature difference. But do you see the asymmetry here? I think you can get rid of some of that white and still show the asymmetry just until, yep.
Okay,
See it?
here we go. Yes, okay. So now we're going to do the hands.
So you see, what I said earlier is we're pattern hunters, okay? So what we did was we did the best we could to bring that pattern out so that when the client sees it, and the doctor has already talked about the asymmetry, they've talked about, you know, how the dorsal, her left dorsal foot shows possible compensation or, you know, injury, something like that. We have
Okay,
shown it correctly.
What I have here is a mattress. Can you see that?
Yeah,
Can you see the hands on it?
can, yes. Looks
Okay.
good.
So I'm going to put that to her legs, and then she's going to bend over. All right?
Yep. Good.
Don't touch it. Don't touch it because it wants to warm up. You don't want it to warm up. So you put your hand in front and no touching. Don't touch the surface. Yeah. Here we go. Okay. Great. Let's see. Wonderful. Keep it like that. I'm going to, let me see, how can I adjust it? I would have it like this. What do you think?
I would make it a little hotter to bring out the
Okay.
asymmetry in the, let's see, not quite that hot. See if you can, you see how you've got more, she must be right-handed.
Mm-hmm.
Yeah.
Yeah.
Okay, so cool it off just a little bit so
Like
that you
this?
can, mm-hmm.
Ja.
What we're trying to do is we're always trying to show the asymmetry best.
Mag je ze omdraaien. Dus zo. En probeer het een beetje bij elkaar te brengen.
Have her push her hands down a little bit, or,
Een beetje
yeah,
naar beneden, een beetje lager.
there we go.
Yeah.
Perfect.
Okay.
Does she hold her
That's fine.
phone in her right hand like this all the time? Because she's got heat right on her thumb there where the phone goes. And I always show people how their phones are affecting them.
Oh, she tells me she's left-handed.
For writing,
Ah,
for writing.
okay,
Other things like sculpting I do as a right-handed person.
Oh,
okay.
oh, she's
Okay.
both hands. She's both sides. Okay.
Oh, she's ambidextrous.
Oh, yes. Okay, let me see. Where are we here? Yeah. So, wat ik ga doen, ga je weer terugzetten.
Daniela, Victor, Monique, are you making sure when you're imaging that your camera is level at all times?
Yes.
Yeah,
Yes.
all the time.
Always be glancing at your camera. Now, it's easy for Francine to always be glancing because she's always walking over there. But,
The mattress again.
there you go.
Even kijken of we dat zo goed in beeld kunnen brengen.
What do you guys use she's using a mattress to keep the arms isolated. What do you guys use, Daniela?
The position.
It's more of plastic. I don't know the material, but it is a big rectangle of plastic.
Okay. The most important thing is that it's thick enough so that it doesn't take on heat.
And that it doesn't reflect heat also. It's not
Right, you
shiny.
got it.
So that our piece of plastic does not shine at all.
Okay, yeah, that's important. I use the dull side of a whiteboard.
Here we go. What do you think of the colors?
Nice.
I used the blanket also on her,
Good.
no, alongside her cheek, but not her shoulder.
Okay.
Very important.
Never cut off the top of the shoulder. That's the big rule when it comes to arms. And she's flipping that mattress over so that
Full side.
uh-huh,
Oh, yeah.
that way the heat that is transferred during the lateral right is not transferred during the left.
It's perfect.
Well, no wonder Francine is so thin. She's she gets a lot of exercise. Okay. Do you use do you do the medial arms?
Yes.
Okay. I only do them optional.
Oh, really?
You don't have to do them every time unless you feel that the person has tennis elbow or you see a pattern you want to look at.
Oké.
Mm-hmm.
Mag hem ietsje hoger op tillen? Ja, de hand eraf. Dit is het. Dit is hem helemaal goed hoor. Oké, dan die andere arm.
Kristin, about the arms, what we used to do was using that big plastic rectangle, you know, to take this
Side of the
arm. But what we do now is when we're taking the back, the patient do this position, and that's when we take the back side of the arm.
Okay.
And we think it's the best thing to do,
Okay.
because some patients don't understand what we try to do with that plastic rectangle under the arms. So
Do you try to maintain privacy for them? So you're trying to describe it as opposed to go back there and help them with it?
well, we're always in front of them, but
Okay.
what we do is always watching our camera so they don't feel uncomfortable.
Sure. Yeah,
during the
understood.
exam. Yeah.
Okay.
But I think the question would be if it's all right to do that, to take both arms when they're making this position and make them turn around so we can take the back of the arm, or is it essential to use that piece of plastic or that material under?
As long as you don't have any artifacts in the background,
Yeah, we don't.
you're fine. You're fine. See, we have overlays, and what our interpreting physicians have is they have overlays that they put on top of our images that show the lymph and the veins and musculature and bones. And so when we take them a certain way, then the overlays that the interpreting physicians use, and I'll show them to you, is they just put it right in there. They put the bone in there, they put the lymph in there. So that when we put our people in the overlays, the interpreting physicians can put those other overlays on top of our images, and that helps them. But any way it works for you, don't cut off the tip of that toe.
Yeah. Oh, yeah, yeah, I see.
You can just zoom out a couple of clicks. That's all you have to do.
Yeah, of course.
Your Zoom is going to help you more than you think, right?
I'm gonna get lazy with this Zoom.
All of a sudden, you're going to gain 10 pounds, and you're going to blame me because of the Zoom.
So how about temperature? How about?
Bottoms of the feet are always difficult because you have to lose your black background, and it's very important to have a black background everywhere but the feet.
Yes.
So you're fine.
Okay.
You're fine. And you're showing the asymmetry. And it's interesting that the asymmetry on the bottom of the feet corresponds to the asymmetry at the top of the dorsal foot.
Absolutely.
You can see that. So the interpreting physician is looking at that and going, what is she doing? What is she doing? And then,
patient on her back right now?
She's sitting on a chair. I'll show you the.
Let me show you. Let me show you let me show you. Can you see her?
Yeah.
So she's holding the board up in front of her head.
We do the exact same thing, but with this, so we can isolate the heat of the body.
Nice.
This piece of plastic, it has this cut off.
Yeah, nice.
And here goes the ankle, the feet, it would be here, and we cannot see the person behind it.
Perfect. Well done.
That's very good.
Well done. Bravo.
Okay. So
That was an excellent imaging. And
Mika
this
is
is
going
what-
to get dressed.
She's going to get dressed. Go ahead and go back to the anterior head.
Yes.
And I want to look at something. Okay, I want you to look at the time, 1952. Okay.
Yes.
Now I want you to go all the way to the bottom of the feet and look at that time hack.
So here,
To 2030.
19. When did we start? 19.
Okay, look at the date down below.
Yes, here.
Okay.
So it says 2030 is now, and we started at 1952. Okay. So
That is awesome speed and great efficiency. Now, why do you think she did a great job on taking excellent images? Why do you think that her speed is a good thing too? I know Francine knows the answer. Francine knows the answer because she's a business person.
I don't want her to cool down or to be inconvenient, you know.
She wants her to come back. It wasn't a long march to the end of an hour and a half. She was very quick about it. And even though you had to jump up and down a lot, you did it.
Yeah.
I'm
And
amazed.
also, and I made some adjustments. Normally I do a full body imaging in 20 minutes or something like that.
Good.
But this is nice. This is so nice with all your comments. I loved it.
I really like that that leg board with the cutouts. That's excellent and not hard to do.
Yeah, it's not hard.
Not hard at all.
Yeah.
Okay, so what
got
I'd like
everything.
to do is talk a little bit about color and
Yes.
temperature range.
I'm going to show my client out. So
Okay.
keep going,
Good.
going. Or maybe everyone wants to have a short break, have a bit
I
of
think
water.
it's a good time for a break. Everybody, let's go to the bathroom and do our thing.
Okay.
And we'll come back here in, do you want to say 10 minutes? It gives you a chance to grab a drink of water, go to the bathroom,
Yes.
whatever.
Perfect.
Yes.
10
Okay,
minutes?
perfect.
Okay, good.
Thank you.
Thank you.
Okay, y'all ready to get started again? Monique, are you there?
Yes, I'm here.
Okay, good.
Always
All
present.
right. While we are waiting for Francine, are you back, darling? Is she gone? Okay,
Yes, she's gone. Yeah.
okay, thank you. She was very compliant too. She knows her left from her right, and she just did what you told her to. That was great.
Wonderful, eh?
Wonderful. Absolutely. I asked Dana if she was coming back in.
Okay.
Okay, so a couple of things we learned here today. Zoom, definitely start using your Zoom a little more, everybody. Go ahead and screen share with us again, because I want to work on those colors. That's the whole reason why we took the imaging.
Okay, great. Okay,
So
good.
let's look here. Now, let me just think about what I need to say here first. So we talked about how we're pattern hunters, okay?
Yes.
Our job is to bring out pattern. And in order to do that, we have to know how to focus, which I think we all know how to focus, okay? Now, you just learned a little bit more. I know that you know what Zoom is, but I think, Francine, you're so used to jumping up and just moving the camera back and forth that maybe sometimes you don't realize, oh, I could just stay seated and I could just click on it on the Zoom.
Yes.
So
Yes.
maybe that's something to practice.
Absolutely.
Go ahead and put the overlay on this image and go ahead and zoom farther, zoom out a couple of clicks. Okay, that's the way the doctors like to see it.
Okay.
And when you leave it like that, that's the way the client will see it. When you put the overlays on it and you image them inside the overlays, when the interpreting physicians put the anatomical overlays, they can put teeth in there and sinuses. They can put on the thyroid, they can actually put the thyroid, the jugular and veins. So when you keep them inside the overlay, our doctors can do a better job at interpretation. But also, the next time that this person comes back, Micah, is that her name, Micah? When she comes back, and she gets a follow-up, has she ever done an imaging with you before?
No, this was the first time.
Okay, great. So when she comes back, you're going to want to match this up just right.
Yeah.
Okay.
With viewer next to it. Yeah.
With viewer next to it. That's super important.
Yes.
Daniela and Victor, do you have a way of putting the images that you took previously up somewhere, somehow, so that you can image like that?
Yeah.
Yeah, we follow a protocol, so the images are always the same. And what we do in the final report, with a follow-up, of course, is that we put the past image, the oldest, the previous image with the date and below the new one. Okay.
Do you have, does your software allow you to make that comparison report? Does it put them side by side for you, or do you put them side by side?
We have to put it side by side.
Side by side. Okay.
Yeah.
All right, good. So when you're imaging, you're looking at those old images so that you can make sure that you're taking them the same as you did before.
Yes.
Yeah.
Okay. That's important because that gives you consistency, and it is also helping the doctors to watch patterns. Now, Dr. Carroll told me a story where just recently she had somebody take the image straight on, and then 3 months later they came back and that chin was lifted up pretty high. And all she did was she lifted up the overlay to find it, and it looked like it fit, but really the chin was up so high that important pattern on the forehead just disappeared.
Oh, yeah.
So taking the images the same way every time is more important than you know. And the interpreting physicians are always, always watching for that. Okay, so let's look at color for just a minute here. Take the overlay off, and are you satisfied with the color here?
I always look for a little bit of white on the inner canvas of the eyes.
Yep, that's normal. Yep, good.
But you also said something about fuzzy, yellowish things.
Yep. Bring the pattern out without too much fuzz. Now, the other thing you can do is, if you want to bring that pattern out, now it looks like, I know what was going on before. You didn't have a stationary image. So go up and grab your ellipse again.
Oh, yeah.
You can do it now. And draw your circle. And what you want to do is take that circle and bring it up to that sinus pattern. And you can just move it around. And you might want to make it smaller. Now, for those of you with total vision, this is a way to do it. What you're going to do is you're going to try to decide if that should be red, if it should be orange, or if you can knock it down into the yellow category. So
we use the same tools.
Good. Oh, that's great. I'm glad.
Yeah.
Okay, so what you want to do, though, is you want a small enough circle, and I see what you're doing there, so go ahead and let that go. All right, so look at what you've got there across the forehead. And what does that tell you, Francine?
Well, there's a temperature difference of at least a half degree, average 0.47, so nearly half degree difference in temperature.
I would argue that it's 0.96 difference between the two.
Delta.
The delta.
Okay.
Yeah. Now, what I want you to do is make the red one smaller. Grab the outer edges of the squares and just make it smaller. Good. And what I want you to do is go to some place that's orange.
Yeah.
And just use the red one. We're trying to figure out if that pattern has earned its red. Okay? And so what I do is I'll make sure part of the circle is inside the darkest red and part of the circle is inside a normal green color.
Okay.
So pull the edge out to the left there, pull it out a little bit into the green. There we go. Not into the blue though. Do you see how you're on the eyebrow?
Yes, yes.
Yep. Get it out of that eyebrow because it'll take that all into consideration.
Yes.
There you go. Now you're at 1.21 and 1.21 says to me, not fully red. And you're not, are you?
No.
You're not fully red. So 1.5 to me on the body says red. Anything above it, we're just getting darker and darker. So just take the middle of that and drag it all the way down to the collarbone down there, or the upper, you know, and go all down to her chest, all the way down.
Yeah, here.
And go between. You got to have some in the red and some in the green.
Okay.
That's how you do it. It can't be black. It can't be blue. So, now we're at 218.
Oh.
Difference. You see how?
You mean there's a difference between the cold and the hot, and that's the delta T.
Yep.
Oh, I see.
But you can raise that circle a little bit more because we have a darker red just above the circle.
Yep. Sure, you can even extend the circle out. Absolutely.
So
go up in here. Sure. That's a good place. Look at that. Now she's in the darker red. Now, like I said, this is very rudimentary. This is not what our interpreting physicians use, at least. Okay. We're just trying to use this as thermographers. We're not trying to be the ones that necessarily tell the client something is significant or not. What we're trying to do is just use these tools to set the color right. And if you can get it to the normal green, not the green that's about to go to the light blue, and if you can get it into the red or the darkest, hottest spot, and you see a temperature differential greater of 1.5, you know that it has earned its red. Right? Okay.
Yeah.
Now, we're looking down here at the throat here, which is out of range of the head. So we're not going to make any adjustments based on that, but I just wanted to show you how that works.
Yes.
Okay.
Yes.
And it can help you. It's there as a tool for you, or else Carol wouldn't have it in the software. It's there for you guys, Danielle and Victor, or else, you know, Flair wouldn't have it in the software. It allows you to set that color right and to say, should this be red or not? I don't know. I'm not sure. Draw a circle. But the rules of the circle drawing are you have to put part of it in green and part of it in the red, and do not grab any blue. Because look what happens. Drag that all the way out into the blue, Francine. You break the rule. Now you're at 9.
Oh,
right?
I see.
Right? Obviously, right? So when you break the rules, it doesn't work. It's between the darkest red or white perhaps, and the normal colored green.
Yes.
And again, it's rough, but it gives you an average to say, yeah, I'm doing this right. And on the head, it's kind of obvious, but on the breasts, you can get turned around. You can think, yeah, this is good. And then you realize you've saved it way too hot or way too cold.
Okay.
Okay.
So, do it again.
Yep. So find a place where you've got red and just a little bit of green. And you see, this is a pretty dark green to the right of that circle. So drag it up high. See how dark that is?
Mm-hmm.
That's going to be a pretty high temperature differential. But if you get it out of that dark green and up into the lighter green, which is to the upper left of that, in there, and drag it all, make a smaller circle, because the bigger it is, the more you have a chance of making a mistake.
Yeah, I
You
see.
see what I mean?
Yeah.
Yeah, that's a good size right there. Now you've got 1.87. And
So this is a significant thing then.
yeah, I don't know if it's significant, but it's earned its color.
Oh, I see. I see what you mean.
Significant is, you know, you're probably using the blue-green palette to interpret, Francine, am I right?
Yes.
Yeah.
Yeah, but also this one, huh? This one.
Uh-huh. Okay.
And because you see the closed vascular pattern here.
Sure. Mm-hmm.
Yeah.
Right. So you're looking at all those.
Uh-huh.
This one is helping us with color and color alone. It's up to the doctor to decide, but you have a better chance of matching up the doctor's interpretation of it if you draw a few little circles and follow the rules.
Yeah.
Okay. Because it would be very easy to make this too hot or too cold so that it doesn't show up. You did it just right.
Mm-hmm.
Something interesting just about this model is when you look at the laterals, you can see that the lateral left is quite a bit more hyperthermic than the lateral right.
Absolutely.
So that's asymmetry. Absolutely.
Absolutely. Yeah. Mm-hmm.
So our doctors are going to measure, you know, the hottest spot in here and the hottest spot on the other side, and they're going to do their job there. That's not something that we would do. But this does bring up the color negotiation.
Yep.
Look at the breast anterior.
Mm-hmm. Yeah.
A pattern.
So what I want, this is another thing I want you to do. Remember on our palette bar over here.
Yes.
For this particular image, the top number is 28.4 and the bottom number is 36.4, correct?
Mm-hmm.
Each and every one of the images in the region of the breast has to have that same range, right?
Mm-hmm.
So what I want you to do is I want you to go to the next one, go to the lateral right, and I want you to heat it way up. Just it all by itself, just heat it up. Okay, right there, good. Now click your file and save on the upper left-hand corner. Okay.
Mm-hmm.
All right. Now I want you to go back to the anterior. All right. I want you all to keep your eyes on that lateral breast, and I want you to click Control R, Francine. Control R.
Control
R.
R. Oh, hey, it's adjusting again.
Yep.
Wow. Thank you.
So instead of having to hand adjust it all across, you hit Control R and it adjusts the R for region. So it's going to adjust the region. Okay.
Where
And
is
it's
it?
going to match them
Control
all.
R.
Control
Where
R.
is- Where can I see it? Control R.
So control is on the lower left side of your keyboard. So it's a keyboard thing.
Oh, Control R. Oh yeah.
Okay.
Sorry.
So what we did was we went around and do you see how, yeah, there we go. So we go here, and when you click Control R, it matches up that range. So now everything is going to be 28.4 to 36.4 or whatever you set it at.
Fantastic. Yeah. For
Okay.
the breast imaging, yeah.
Right.
And
And for
Monique-
every
Monique-
region, for the head,
This is just for the region of the breast. So
no,
not
it's for
head,
every region.
for
so-
every region.
So go back to the head.
Oh my. Okay.
Okay. So one thing that is a big no-no in in the thermography world is to say, oh, I'm going to adjust the anterior head. So this one's at 29.3 and 37.3 on the pallet bar. You see it?
Yes.
Okay.
Yeah.
Now go to the lateral right.
Yeah.
Okay. Click on that. And let's say that you're like, oh, no, I want to cool that off a little bit. So cool that one off a little bit. Okay. Now go to the lateral left and heat that one up a little bit. Oh, I want to heat that one up a little bit. That is a big, big no, no, no.
That's
Every
right.
single one of them must match in the region, and the head is a region of 3. So what you
Yes.
do is you go back to the head, you find the way you like it, and you hit Control R and watch what happens down below. Control R.
Yay.
Boom.
Wonderful.
Okay.
Yeah, but what it does, the software knows, okay, these 3 images belong together.
Yes.
So it doesn't with all the images, you know?
Nope. Nope.
Nope.
And not unless you hit Control A. Now.
Oh no.
So yeah, don't do that. But here, there is a way. There is something interesting.
Yeah.
I want to address anybody. Maybe Monique has this issue where when you're imaging, you're doing frame focus color. You're making sure it's
Yes.
framed. It's in the frame. You want to focus it. Oh, does it focus? Is it colored right? Right? I'm sorry.
No, sorry.
Okay, so
No, nothing.
so let's say that you feel like it's just too much. Okay,
Yeah.
what you can do is you can image in grayscale. So go ahead and go to enhanced grayscale
Yeah.
palette right there. Okay, that's
this
just
is-
there it is. That's enhanced grayscale. I want you to hit now Control A. No, don't do it. Don't do it. Just hit Control R. Control A will turn the whole thing. And
Control
that's fine.
R.
Let's just do Control R. You
Oh,
see?
here we go.
Okay.
Oh,
No,
wow.
Okay, so you may want, any of you may want to get out of color and not have it be important to you so that you can absolutely concentrate on frame and focus, because frame and focus are things that are difficult, if impossible, to change once the client walks out the door. So if you have an issue, if you think I don't feel like I'm imaging well and I'm feeling too flustered when I'm imaging, and this is for new people, you guys are probably very confident, but if you really want to make sure that you have a concentration of frame and focus, image in grayscale and go back later after the client walks out the door and change it all to color. And then you can really think. You can really think. And now when we teach brand new thermographers, that's how we teach them. You image in grayscale, you don't think about color. And then after they leave, all you do is think about color, right? Okay, is that helpful to anybody?
Oh, yes, very much.
Okay, if you're teaching somebody, if you have the opportunity to teach someone, I highly recommend you teach them to image in grayscale and then to turn it color later. Frame and focus they can do. Add in color and their head starts to get wonky.
In this one, huh? You want them to learn screening?
It's in we want them to do it in enhanced grayscale.
Oh, this one.
That one. That helps.
Yes.
Gives a little color to it.
Yes.
But it really just gives you then the rudimentary colors. As you move down the body, it starts to get dark because it starts to get cold. So all you do is you heat it up a little bit just to continue to move on down the body. But you're not looking at all the little details of color. Okay. All right. You did a great job. Obviously, you know what you're doing on color. But that Control R is something that's important. And I want to make sure that everybody knows, no matter what camera system you have, that each region of the body has to be set at the same color range.
Yes.
Okay? It has to be, or else you'll mess up your interpreters and nothing will match up and it's not professional.
Yeah.
So
if I'm not sure, if I cool this down, so I can go back, I like this color, I just do Control R, and I'm sure everything on the abdomen is the same.
right. Because you know how you mess around. I would heat this
Yes.
up a little bit and see what you can get.
Yeah, me too.
See,
Yeah.
and because I'm a pattern hunter, I'm always trying to find it.
Yeah.
So I look at this and I see the large intestine
Yes.
in the lighter green. And I'm like, huh, can I bring that out? Can I bring out the large intestine a little bit? I keep it in color once I'm to that point. But now
Wow.
back it down, go back to color and back it down and see what you're left with. So you got a little polka dots there. I'd bring them out. Little-
Oh, how do you
little
bring
bit.
them out? Like
Yeah.
this?
Yeah,
Oh.
not that much fuzzy yellow, not that much. Yeah.
Like
Now
this?
see, okay, so Francine, you're not sure, should that liver, the pattern over the liver, should that be red or not? How are you gonna tell?
Oh, do we use the this one again?
Yeah, try the ellipse, see what you get. Just a small one into the green.
This one again.
Yep,
Oh, I see.
look,
We have 1.55, so it is a significant, or it is a pattern.
it
I
is
see.
a pattern that deserves to be brought out.
Yes, now I see.
You see?
Thank you.
Het is echt geweldig dit zo.
I'm learning so much. Yeah,
No.
fantastic.
Good. I'm glad, because I thought if Francine can learn something, anybody can, because she's really good at what she does. All right. And I mean, all of you guys are good at what you do, but I know Francine's been around a long time and she's an interpreting physician. So it's, you
Yeah,
know,
wonderful.
it's wow. Okay, so we're pattern hunters. What are we looking at here?
Yeah, the six S1, S2,
Uh-huh.
those things here.
And it never hurts to bring out a white pixel on the back.
Look, those 3 dots on the bottom.
It never hurts to bring a white pixel out in the lumbar area.
Uh-huh.
So go back into color and then
Yeah.
just first white pixel, see what you get. So just go down to like just where you see a little bit of white, get rid of the fuzzy yellow. There it
Like
is.
this?
You
Okay.
see it?
Yeah.
You got the pattern out there. Does she have any lower back issues? She's crawling around on her hands and knees with that baby. So maybe she's got some temporary.
Mm-hmm.
Yeah.
You're
Right
a little
here.
bit too much into the, you're a little bit too much in to that darker green.
Okay. So
Get it out of the darker green. It breaks the rules as soon as it goes beyond green.
So more like this?
Yep.
Okay.
And it's orange, it's not red. And there you are at 111. Very nice.
Yes. Okay.
Yep. But always remember that green rule. If you follow the green rule, you're okay. All right. So I'm going to ask you something.
Yeah.
Is the camera a thermometer? Monique,
No.
is the camera a thermometer?
At some spots.
No, the camera is never a thermometer, ever. What is the camera? What can we count on the camera for accuracy?
Yes.
What can we count on the camera to be accurate? What does the FDA say we can claim? Or other government bodies say we can claim about the camera?
You said the temperature differences.
Bingo.
Okay.
We can claim the temperature differential.
Mm-hmm.
And that is how our doctors examine for significance. They are assessing significance using temperature differentials. If we can set the color to match up with the temperature differentials accurately, it is a scientific fact that we will always have the interpretation match the image. And when the interpretation and the images match, you are a very professional and elite thermographer.
Mm-hmm.
Okay? So it is so important.
Mhm.
It's more important than I think we all knew at the beginning of this day. Am I right?
Yeah. Oh, absolutely. Yeah.
Okay. All right.
That's
So
great.
let's
Yeah. It's great.
go
huh?
ahead. Any questions?
I have a question. Maybe it's not related to what we're
It's
seeing in color, but what would that pattern mean on the lower back? Those 3 points, those like.
Let's let Francine answer that.
Yeah. What I see is hypothermia. This could mean subluxation which can cause this hypothermia. And, you know, the whole spine is like a domino effect, you know, it is, it's all connected. So, what it actually is, we don't know, but she really needs to see a chiropractor, or what we can also do is put in the grid, see if she has an elevated hip or what
Yeah.
other things are going on.
Look at that
She's
left.
sure-
Look at
and
that
she's
left
sure-
hip.
Yeah, and she has a dropped shoulder, you see? So the right shoulder is more down than the left. Yeah, Danielle?
Okay. Yeah, I wanted to ask you, because some of our patients come to us with bone density
Problems.
exam before, and we notice that when we have these kind of patterns that are like I don't know
Modded-like.
model-like.
Models.
Model-like.
Yeah.
Models,
They
yeah.
they have a low density bone, low
bones.
bone density.
Oh,
So
really?
yeah, it's happening a lot frequently with our patients.
You know, this
And-
mottling pattern usually refers to hormonal disturbance, hormone
Yeah.
issues.
Mhm. Yeah,
And-
absolutely.
and that's quite matching the low bone density, because
Yeah.
this
The
patient,
estrogen.
how
Yeah.
how old is she? If
She is
48 years
48.
old, right?
Yeah.
So her estrogen is getting lower, and that's how we can think about lower bone density.
density.
And,
Wow.
and it's been frequently with our patients when we have this model pattern.
Wow.
Uh-huh. Absolutely.
Very
You know,
interesting.
And when we don't find this model-like pattern, and it's quite just a red
A single pattern.
it's about the muscle.
Yes, I
That's
see what you mean.
we found
The sacroiliac joint, though, the sacroiliac joint is unique in that it does often present like those 3 dots.
Yeah.
That SI joint does present that way.
And we find another one in blue.
Okay.
In blue?
Right in
Yeah. And
in the right
Mhm.
there's a
one circle pattern
Mhm.
on the right butt cheek.
Right. You
I
can
see
put
what you
that
mean.
put it in a different palette, Francine.
Yeah.
Mhm. It may not be significant enough,
Yeah.
but it could be
Yes.
something that you would watch
So
because
here,
it's coming. It's coming.
so here you have the polar pattern. Then on the other side here.
And there you go. You're in the
Yep.
black. You're in the black on that red circle. Bring it in a little. There you go. But what they're talking about is on the right buttocks.
Yeah.
In here
Above.
and then just a little higher. Yeah.
In your number 2 circle,
The green circle.
the green circle have to be more higher to
Okay.
get
Yeah.
that one.
Get up and
spot.
up, and to the left a little bit, up higher. Yeah.
A little bit more.
You're better off looking at this in the
other pattern.
Grayscale.
in the lower back as opposed to the trunk.
Oh, I
But
see.
you can see the
Yeah,
differences.
it's lower.
Yes, yes, you see it. Uh-huh.
Yep. Interesting.
Yeah, very interesting. Yeah.
And
Mhm.
you know what Dr. Carroll would say right now if she was here is she says, okay, keep an eye on that.
Mhm.
But you know, that's the interpreting physician's job. Our job is to make sure that we bring that pattern out for them to see. And also, we have a way of sending a note to our interpreting physician, because sometimes we see something that they don't have time to spot. And so this would be that case, and I applaud you, Daniela and Victor, for finding that.
Yeah,
So,
thank you.
so what you would do is you would write a note. Let's say Francine is your interpreting physician. You'd write a note and say, you know, thermographer's note, hypothermic spot on right buttocks as indicated by the arrow, and you can put an arrow on that. Is this something that I should watch? And this is a private note that you can write. The patient doesn't see it. And, you know, that might be something that, you know, that you have a way of doing that as well. And then you can keep an eye on that yourself. I was watching a spot on someone's abdomen, and it just kept, every time I saw her, it kept getting colder and colder. And I didn't think that the interpreting physician was tracking that. So I asked them to. I said, will you please go back and look at the last 4 times I've imaged her and see how that spot has gotten colder and colder and colder. And turns out that she had some kind of tumor there, and it was getting colder because the body was redirecting blood from the surface of the skin towards the tumor. And so it was a cold spot, not a hot spot. Fascinating, huh? Crazy.
Yeah, absolutely.
Okay. All right. So now that we have been talking about this, I'm going to ask you guys again, what is the main focus that is helping the interpreting physicians decide, and what is their main focus? What are they trying to determine? When they're looking at all this, what are they trying to determine? What is very, very important to them? Something we didn't realize until this morning. What?
Finding as much pattern as possible.
I can't hear you, Monique. You sound far away.
Finding as much patterns as possible.
Okay, so that's important to them because there's a big reason for that. There's a big reason why they're trying to identify patterns. Because they are trying to decide whether it is significant enough to recommend further clinical investigation. If our thermography physicians, if our interpreting physicians miss something and don't recommend that the client go get this investigated by their primary care physician or whoever, then they have fallen down on the job. So the main focus of the interpreting physician is and should be, is this pattern significant enough for me to recommend to them to go see their doctor to get it looked at? Because we're not diagnosing, are we? Not in any way, shape, or form do we ever diagnose. And so if something needs diagnosing so that it can be treated, we want to be the ones to say, hey, you might want to take a look at this. We're not saying it's, let's just take, for instance, breast cancer. We're not saying it's breast cancer. We're just saying we found a pattern that is significant enough to advise to you to go to your physician and get it looked at. Now, from there, you lose them. Are they going to go get a mammogram? Maybe. Are they going to go and get an ultrasound? Maybe. Are they going to go to their chiropractic physician or their acupuncture and go to a functional medicine doctor and do lymphatic drainage? Maybe. I wish that was up to us. Some of us work in clinics and have professions that can not only look at this, but also do the clinical correlation. We have a lot of doctors, medical doctors here in the United States. Are you guys, Daniela and Victor, do you work for a medical doctor?
I'm a doctor.
You're a medical doctor.
Yeah.
Yeah. Daniela is a doctor.
I did not know that. Okay,
Yeah,
so
I am.
Daniela, you're able to provide that clinical correlation. You're able
Yeah,
to
I
say,
do.
I want you to get an ultrasound. I want you to
Yeah.
get a mammogram. Uh-huh.
Yes. Mhm.
Okay, so that's important because it's as thermographers that are in our own business, like myself, I'm not a medical doctor. So I have to rely on my client to go to a person who's going to advise them the right way and do the right tests. So Daniela, what would you say if a report came back that said that this was a very significant pattern, highly recommend immediate clinical correlation?
Can you repeat the question, please?
So let's say somebody has a breast pattern
Yeah.
that says this is, highly significant, recommend immediate clinical correlation. Let's just say that one of these patterns here was so significant that the interpreting physician recommended immediate clinical correlation.
I would say first to ask about their family. If there's a history of cancer in their family, that's a very powerful point to me to ask them mammography. And even if they smoke, that's a very important point to tell them that you're in a risk of breast cancer. And I would send them to first a gynecologist and to ask a mastography. Yeah, absolutely.
So my point that I'm trying to make by asking you that is,
yeah,
you're going to do what's in the best interest of your patient.
Yes.
And you're going to recommend you're going to do what you do as their doctor. And as the thermographer, if I'm your thermographer, I don't have any control over that. You are their doctor, and you're going to make that decision about what you're going to do. And you're going to do that based on what your education has taught you and what you know based on being this patient's primary care physician, you think is in the best interest of the patient.
Yes.
And that's the whole point. We're pattern hunters. Our thermographers, our interpreting physicians are pattern interpreters. They're going to decide if it's significant or not. And you as the doctor at the end of the line are going to decide what you're going to do with that information. And you're going to do the very best for your patient. And that's how it works. And some of our thermographers think that they have to take control of that process. And we always have to say, I know that you're a nurse, or I know that you're this or that, and you have a lot of medical knowledge, but what you need to do is stay in your lane. Do you know what that means? Stay in your lane. Do what you're supposed to do and take the best framed, focused, and colored images out there so that our interpreting physicians can tell a physician like you, Daniela, this is what we're seeing, and then you're going to make your decision about what you're going to do about it. And that's the change, right? Okay, good. Sorry I went on and on about that, but
No, that's
No, it's perfect.
it's important, guys.
It's very
Okay,
important. Yeah.
so you guys did a fabulous job here, Francine, and I admire your speed and your accuracy. You can look at her stand on that leg. Look at her lead.
You see that?
Wow.
Wow, she's twisting.
Yeah. Now you know why that dorsal foot is so hot,
Yep.
Yeah.
right?
Yep. She's leaning over on the left side.
Yeah. Yep.
And
And
then
you
we
can
have
see it
the
on the
asymmetry. Yeah.
And sometimes when I'm working with a doctor, I worked with a lot of MDs. I went to their offices. I would point this stuff out to them. Now, here's another thing I want you to look at. I want you to go to the hands right here. Okay. Now I want you to heat this way up. Good. Now hit Control R. And notice how both hands, again, adjust.
Yes.
Okay.
Yeah.
Now, this is one place where we can break that rule, because the dorsal and the palmar are two different sides of the body.
Okay.
So you can adjust them separately.
Oh, okay.
Okay, so you adjust the palms and you can get some of that white out of there, leaving you leave your asymmetry. So look, nice, you got your asymmetry right there. And then you can click and save it, and then you can go to the dorsal and independently adjust it. Anytime you have two different sides of the body, you can do that.
Okay.
So don't hit Control R.
No. Mhm.
Do it separately. Now, where else
Oh.
do you think that would apply?
Foot.
Right.
Yes.
So if you go here and hit Control R, she might have separated that in this new one. Go ahead and hit Control R here. Nope. So these are together and they don't need to be. We've got plantar and dorsal. So don't hit Control R for this. And you don't have to. So even though Daniela and Victor, you guys don't have a Control R necessarily, don't feel that you have to, just because it's the foot, that you have to make those the same. That's not the rule that we're following. Same thing with the knees. They're two different sides of the body. And if you see like a varicose vein or something on the back, the posterior legs, you can adjust posterior legs separate from anterior and laterals. I like to keep the anterior and laterals together on the legs, not the knees here, but the legs. And then if you see something, if you see something on that posterior leg that you want to bring out, you can adjust it separately.
Okay.
Same with the trunk. I think the trunk is separated now, but.
Oh, let me see. Control R. Go. Okay, now it's the same. Yeah.
It's separate. But the legs and feet are not. So make sure you know that even though it is professional protocol, to keep everything in a region together, when you're looking at two different sides of the body, the posterior and anterior, you can change them separately.
Yeah.
Okay. All right. Go ahead and any questions here before we move on?
Well, I just want to say I want to leave in a short while because I've been working and it's 9:30 p.m. here. So I need to drive an hour back to town.
Oh my goodness. Okay. We really got a lot in here today. If I could just kind of close it off, we can stop now and I will hang around for anybody who has any kind of questions.
Okay, I will stop share.
Stop share. Okay.
Yep.
And let me just grab something here. Okay. I just want to quick go. This is quickie because I know you all know how to focus. You wouldn't have come this far if you didn't know how to focus your images. You'd been kicked out of the club by now, right?
Yeah.
So how are you, Daniela and Victor, how are you feeling about going another 15 minutes or so? We'll let Francine go and then I'll hang around as long as you want and we'll do anything you want.
Nice.
Yeah, perfect.
And Monique too.
Yeah.
Monique too. I'm here, and I know you have to go, Francine, but I'm here to stick around because I promised you guys I'd be here for another hour and a half. Okay, let's just talk about focus very quickly, okay? Recognizing good focus is something that we have to do on the fly. It's not something that we can come back to after the client leaves, right? So it's something we have to be very good at doing spontaneously, is looking at that and going, nope. So some of the ways we look are edge of the body. We're looking for extra color at the edge of the body. Because what it's doing is the camera's not focused, so it's kind of picking up the back and the background. It's kind of picking up the body itself, and it's just sort of confused about that because it's not focusing. As soon as you're focused, you lose that cold line on the edge. So the best way to find it is to go somewhere where you've got green and look between the green and the black. If you go to the blue and the black, it might fool you, you see, because it's a blue line. Okay? Here's how we used to image with this old school pixelation. And here's how we image today. So high resolution is something that has taken the world of thermography and brought it so far forward because now we can see, oh, that's a lymph pattern. This pattern is, you know, it's significant. You can measure different aspects of the pattern, things like that. Whereas back in the year 2000, this was state of the art right here. Okay. So it's important to use your focus and to use your high resolution to make sure, because you'll disappear patterns with bad focus. This is an important pattern here on her arm. It's asymmetrical, right?
Yeah.
Poor focus gets rid of it. Done. And so that's, I know that you guys know this. I just want to make sure. Do not cheat your client with a fuzzy image. Any interpreter cannot interpret a badly focused image. If they try, they're guessing. And now we're not giving the best.
Yep.
So our interpreting physicians will immediately reject more than a couple of focused images, unfocused images. They can't be fixed. A badly focused image requires bringing the client back to redo the images, and we affectionately call that the call of shame. The call of shame. Oh no.
No.
For those of you that have our software, there's 3 ways to focus. You can autofocus, which focuses correctly about 80% of the time. You can use the little slider, and you can use the keys on your keyboard. Do you use the keys ever, Monique or Francine?
No.
Yes, the keys
Yeah.
always, every day,
Okay.
always, all the time. Yeah.
Yeah, I use the keys. I used to use the keys too. This one is my least favorite here.
Yeah, me too. Yeah.
Least favorite. Okay.
Mm.
All right. So another way, obviously, we're recognizing good focus with hair, not a blur, with eyelashes,
beautiful. Yeah.
right? Okay. And this
Yep.
is a very high resolution camera. This is a 640 by 420 here. It's not always quite that sharp, but you know your own camera.
Yeah.
Edge of the body. Any other ways you guys can focus better? Tell me.
Use a piece of lace.
Very nice. You guys ever use lace, Monique? Daniela?
Yes, I do.
Victor, good?
What?
The lace
Sorry,
is
what?
excellent.
Yeah.
Why is that? Why do you think the lace works?
Lace?
Yeah. Okay, tell them about the lace, Francine. Victor
What
looks
is a
like
lace?
he's about to fall off his chair.
Oh, lace. What is lace?
What is lace?
I don't understand that word.
I'm trying to figure out, lace. It's
Sometimes
pretty,
you have it. Sometimes you have it on the underwear.
yeah, little edge of the underwear, pretty.
Oh, okay.
Lace. What do you call it? What do you call it in Spanish?
It would be called resorte.
Oh, okay.
Resorte? Okay.
Yeah. The
So we
lace.
realized
Oh,
that
but
it
I
worked.
understand what you mean.
We realized that it worked when we were looking at women's underwear that sometimes had little lace on it. We went, wow, boom, the camera can grab right onto that. Why do you think it grabs onto that so nicely? Do you think it just likes lace? Do you think it likes pretty things?
Yes, I think so.
It's the pattern. The camera, the more intricate the pattern, the better the camera focuses.
Yeah.
That's why the head is usually pretty easy. You've got hair and nostrils and lips and eyelashes and eyebrows. It's intricate pattern.
Yeah.
So when you've got something like an upper back or an abdomen with fuzzy pattern, you can't see any intricacies of it. It'll sometimes give you some trouble, won't it?
Yeah.
The other way is to go into a grayscale, a reverse grayscale, whatever that is. Go into a reverse grayscale and you'll see the pattern better. The camera will see the pattern better in reverse gray. And also look how important this is. Do you see this circle here? I mean, this could be a significant pattern. And if you don't take the image correctly, the doctors cannot measure that properly. They cannot visualize it properly, and they should send it back. If they try to guess, the client's being cheated on. You see the difference here. So this is reverse gray, where the hot is black and the white is, I'm sorry, and what is this grayscale? So this is reverse grayscale, and this is what?
A normal grayscale.
Normal, regular grayscale. And then whenever you see colors, that's enhanced grayscale. So it's the reverse grayscale where it puts the patterns in black.
Okay.
That really helps you focus and know that you're focused the most. Okay. if you don't have a piece of, let me tell you the rule about using the lace. You take the lace, let's say they've got their back to you, okay? They got their back to you and it will not work, okay? Let's say you just can't get it to work. You give them the piece of lace and you just say, I'm going to give this to you, or maybe it's hanging on a hook nearby, they can just grab it. But don't make them walk over there to grab it. It's got to be within arm's length. They flop it over their back and let it lay on their back. You quick pop the focus and they just drop it on the floor. Drop it. Because if they walk away and put it back on the hook, you blew it, right? So they can lay it over their back, lay it over their arm, lay it over their abdomen. Focus immediately. Focus just goes boom, drop it.
Okay.
And you've got focus right away. Okay. So you guys know this rule, right? If you change distance, you change focus. You have to. If they're here and they walk forward, so they're now here, and you don't refocus, they're going to look like this. You know that, but sometimes Dr. Carroll says even the most experienced thermographers sometimes forget. And you're in a hurry and you're not thinking, okay?
Okay.
So we've got going into Grayscale to look for patterns, looking at the edge of the body, and looking at details like hair, eyebrows, and we don't have lace on here, but using lace is amazing. It really helps you. You can also use a feather. They can have a feather in their hand and just lay it up against the body. And because of all the little feathers inside the feather, it's the intricate pattern the camera's looking for to focus, right?
Okay.
So even though focus is something that we harp on in our new class, when we have brand new thermographers, I'm not going to harp too much on it. I'm going to assume that you know how to focus and you know the importance of it. Where we really have issues is in people coloring it right. We still have people that have been around for 10 years that don't know how to color it right. So that's important. Let me share something with you. Can I move this? Yes. Can you see this?
Yeah.
Okay, good. Is it super small? Or is it a good size for you?
It's a good size.
Okay, good. Now, Francine was doing this. So this is how I move something around. I'm going like this. I can just drag this little thing all over the place, okay? And I made this extra hot just so that you could see, okay? So I'm looking here and I'm like, there's red in there. 1.28, I'm gonna knock that down so it matches 1.28, okay? I like that. Then I disappear my circle. If you leave your circle in there, you are going to very much confuse the doctor, okay? Now that I have it the way I like it, watch down here, Control R, boom. Now, the only other thing I wanted to talk about is color negotiation. And I thought this was a really good study for it, okay? Because here she looks good. When she turns to the side, come on. When she turns to the side, we've got, it looks really too hot, doesn't it?
Yeah.
Okay. So now we've got this issue of how can we maintain this pattern and try to cool this off a little bit? And that's what's called color negotiation. And what I realized with this model was that I couldn't, because then I was disappearing this. Come on, over here, come on. It's taking us a little time, okay? I disappeared an important pattern, okay? So I'm gonna put it in there as light as I can while maintaining pattern. I'm gonna hit Control R, and yup, it's gonna be hot. Now, one thing she didn't tell me when I was imaging her was how badly her neck hurt. So her sinuses were nothing special up here. I mean, she was having a little trouble, but really, she was dealing with bilateral neck pain.
Kristin, can I ask you something?
Yes.
This image, in the front,
The interior
interior image.
Yep.
I can see a difference between the sinuses.
Yeah, oh, definitely.
Is that important? Because you're you did a measurement about one sinus, but not compare in both.
But that's not my job.
Not comparing one to another.
But that's not my job.
Ah, okay.
My job is to make sure that my doctor can see that pattern and my client
Okay.
can see that pattern.
Oh, okay.
The doctor's job is to compare and see if it's
Oh.
significant.
Okay.
That's the doctor's job. And they'll do their job because she's reported sinus issues.
Yeah.
Okay. So the doctor will do their job. And then she's also reported, let me see, this thing is being a little stubborn here. This is the brand new beta. Okay, here we go. All right. So this is color negotiation. Sometimes you have to lighten up a pattern here, but don't disappear it, and don't disappear your asymmetry, because they'll know to measure it. We've got enough asymmetry there, they'll know to measure it. Now over here on this lateral, it's important to bring this out. Do we want to lighten it up a little bit? Yeah, we do, but we can't, because that's what color negotiation is. We have to keep it all at this range, 27.8 to 35.8. We have to keep it there. So she's complaining of neck pain, and we've got it. Do I want to make this lighter? Yes, I do, but I can't, because I don't want to disappear this. Okay, that's color negotiation. Leave it a little hot, too hot here, so that you don't disappear an important pattern there. Okay, color negotiation. Then when we get down here, we see a little thyroid pattern, possibly. Not my job to say that it's hypothyroidism. So I'm going to try to leave the pattern in there for the doc. Okay, I'm going to try to leave that in there for the doc. And then I'm going to hit Control R. I'm going to match it all up. And I think I did a pretty good job here. We always have base of the carotid right up here. We always have that a little hot. And then when we go to the other ones, this thing is being weird. This is the brand new, so bear with me here. So we're leaving this in here. We'll say, does this deserve to be red? Should it be red? Should I take it down? Let's see. I'm going to go from the green into that little reddish spot there. And this is more orange. You see, it's not red, 1.4. It's earned its orange. It hasn't earned red, but it's earned its orange, right?
Yeah.
Yep. As soon as I get out of the orange and I stick in the yellow, look what I drop down to. Okay. So that helps me if I follow the rules. The only rules that you have to follow is don't leave your circles in there. Like I said, you'll confuse your doctor. Okay. Now, here's something you were talking about, hormonal mottling. See if we can get there. There we go. A lot of fuzzy yellow on the top, but our job on the back of the neck is simply to show the back of the neck. That's all. Ignore this. Show the back of the neck. It's always a little red, and there's usually a pretty good distinction here. And then when we get it, there's no Control R here because it's a region in and of itself. It doesn't pair up with the upper back. Now, you were talking about estrogen dominance. You were talking about the mottling.
Yeah.
This girl has food allergies. And so that's another reason for mottling.
Okay.
Wait till you see her abdomen. And her breasts are hyperthermic. By the way, the upper back is probably one of the only places where you have to have fuzzy yellow because you have to show some pattern.
Yeah.
The modeling can be in the arms, right?
Oh gosh, with hormonal imbalance and food allergies alike, and sometimes they have both, they can be modeled from head to toe. They look like a leopard.
Yeah. Okay.
Yeah, you've seen it, I'm sure.
Yeah.
Yeah.
A lot.
Yeah. Let's put the overlay on this one. What did we do here when we imaged her? Let me go to the, what did we do here? I'll give you a hint. We accommodated for the,
We have to zoom closer.
Could, yeah, we could zoom a little closer. What I'm saying is we accommodated for the larger breast.
Oh, yeah, the linker, the left one.
You see, smaller breast, larger breast, very common. Always accommodate for the larger breast.
Oh, okay.
Good? Okay. Now here comes Mottling City here. So here's another color negotiation we had to do. She was modeled under here, and she had a lot of heat. She uses aluminum-based deodorant. She doesn't dry brush at this point. This was a year ago. She does now. So I had to negotiate, and instead of trying, watch what happens if I try to bring out more color. Yeah, I brought out more color. And that probably could be a way to stay, but when I hit Control R, this gets even hotter under here. So I'm going back and forth, aren't I? Because I got to keep these numbers the same throughout the entire region. Okay.
Okay.
Now, let me ask you a question, and I want everybody to vote on the answer.
Okay.
Let's say that I took this entire breast study, okay? Then I went through and I did look at the mottling here and look at the jacked hip. Come on, come up. Look at that jacked hip. She's standing straight. Look at all this mottling. Food allergy, big time. She didn't know she was allergic to eggs. And she, at this point, didn't know she was allergic to dairy either. It's everywhere, isn't it? She's just one big mottled mess. You should see her now. She's nice and clear. She gave up wheat, dairy, and eggs. But anyway, let's say we get all the way to the end here. We took some extra images. And we say, oh, shoot. That one breast was out of focus. What was I thinking? It can happen, right? It can happen. So now, what do I have to do?
Take a new picture. Then is it the same day? You see it on the same day?
It's the same day. It's just 10 minutes later.
Oh, I would take a new one.
Take a new image?
Yeah.
What would you do, Danielle and Victor? Everybody vote. Everybody weigh in.
Well, if just several minutes, I could call her back.
Oh, she's still here. She's still here.
Oh,
Yeah. You just got done with the abdomen. You're in here. She's still undressed. And you go back and you look and you go, oh, shoot. Oh, I just need to retake. What are you going to retake?
Just that one image. Yeah, but I would definitely take a new one.
Okay, good. Francine, what would you do? Can you hear us? She's taking apart her equipment, I guarantee you. Okay, this is what I'm going to tell you. You have to retake the entire region. Even if it's only been 2 minutes, fine. If it's been more than 5 or 10 minutes, retake the entire region. Things change. Remember, we can't claim temperature, but we can claim temperature differentials. We really want all of this throughout this whole thing to match up. It won't match if you go ahead and insert one in there 10 minutes later. As a matter of fact, sometimes when I'm imaging with students and they're learning how to image the breast and they take a half an hour to go from here to the oblique, there's no way we can interpret that.
Okay.
You have to have them go back and take these again, not the chest, that's not part of it, but start with the anterior breast. And that's why Dr. Carroll won't let them pass. We won't let them pass their class until they can do a breast in 7 minutes. Because from anterior to inferior, if you can't do a breast in 7 minutes, your breasts don't match up anymore. Okay?
So that's the deadline, 7 minutes.
That's the deadline. Yep,
Okay.
yep. So let's see what we got here. We got 8:52 p.m. here. And back here, we've got 8:54. I'm a fast imager. So we took all of these in 2 minutes. Okay?
Okay.
Anything within 7 minutes is fine, but I'm telling you, don't think you can go back after you're done with the trunk or the feet or however far you're going and go back and slip one in there. You can't.
Okay.
The
Perfect.
head, the thyroid, the abdomen, nope. Got to retake the whole region.
Region.
Okay?
Perfect.
Okay. All right, let me stop share all that. And any questions?
Okay.
Now everything's
Okay.
perfect.
Oh, I know what I want to show you. No, not that one. I think I just got out of it. Screen sharing has stopped. Yes, thank you. I know. I'm aware. Let me just get out of a couple of things here.
Mhm.
And all right. I want to show you something. This may be different for you guys, but let's say that she comes back. This is, when is this? This she had done in March of 2020. And now she comes back in August of 2021. Let's just pretend. And let's say that I want to do a comparison report just on her head. She's been working on those sinuses. So print comparison report. Oh, did you see that? I'm going to go to file and print comparison report. And then I'm going to go back to, we don't have a 2021 here, but I'm just going to go here just to show you. So you just go back to the date you want to compare to. Okay. And then you let it build. You just click what you want to do. And then it'll build it for you. Now I'll show you what I mean.
Nice.
Okay, I'm not sure, Monique, if you know what you can do here, but it'll take the date, whatever today's date is, it'll be the after, obviously.
Yeah. This
And
is
then-
this very, very good for in Holland.
Do you do that do you do this, Monique? Do you use this tool?
No, but there is a point in Holland that people are arguing about thermography and mammography.
Yeah.
And this is something like a marketing thing we can deliver. Do
Well,
you understand?
yeah, I get that. It's also a way to help her, to have her go to her doctor or whatever. Let's say that, you know, she's going to you, Daniela, and you're helping her with her breasts. And then, you know, her doctor doesn't believe in thermography, but she goes back to her doctor with a before and after. Like, let's say this is the breast, the before is the breast back in 2020, and here's the breast in 2021. And you can see that she's been doing an anti-inflammatory diet. She's been dry brushing. She switched to a wireless bra. She switched to a non-aluminum deodorant, and all of a sudden her breasts started to clear and look beautiful. You can put those pictures side by side because they could go to their doctor and say, yeah, my breasts feel better. They're not sore. They're not tender. But if that primary care physician or that other gynecologist, whoever, she says, I've been going to Dr. Daniela and she's been helping me with my breasts, and they can at least see that side by side. It's amazing. Let me show you some that are side by side. Let's see. Looks like Francine cut out. Okay. All right. So I want to just show you some side by sides. I didn't have this queued up, but I can get it pretty quick. I have some decent ones here. Bear with me. Okay. Here's a good one here. You'll like this one, Victor and Daniela. Okay. Okay. Food allergies. They're just a mess. And then they start avoiding the foods that they take a food sensitivity test, you know, something along those lines. Do you do a food sensitivity test? Do you have one you like?
So sometimes, but we prefer to give them a diet that could work and
Yeah,
they get better. But here in Mexico, it's kind of hard and complicated to someone
To convince someone
to
to
convince to
Ah.
do the
do
test.
test.
Hey, it's the same everywhere. I mean, we have a $400 test that'll test for 300 different foods, and they're like, $400 is too much, you know. Okay, well then just give up wheat, dairy, you know, and oh, what did you say gave you a stomach ache? Okay, give that up too. And half the time they come back less modeled, right?
Yeah.
And if you can show them, because sometimes they're still feeling poorly, like this girl was right in the middle of it. She actually cleared even more after this. And so if we can just give them a little bit of encouragement, you know, that says, look at how much better you look. Yay. They'll keep going with the diet, or maybe they're taking some supplements from you or doing some treatments from you. Let me see if I can find another one here. Some befores and afters.
If someone have food allergies, how long you have to wait to do their follow-up?
I would say at least 90 days.
Okay.
I would say 90 days. Now you could do it during, you know, like you can do like 6 weeks, because that helps you as a physician monitor the treatment, right? So if after 6 weeks they don't show any change at all, you may have to pivot a little bit. Pivot meaning change.
Oh.
You may have to change a little bit. You may have to change your treatment a little bit. Now, when it comes to breast clearing, we can do this in 2 weeks with dry brushing. This goes fast. This goes really fast. So, sorry, I got a doggy in here. Hang on 1 second. Okay, go ahead. Go ahead, go bark. Go bark. Go. Little dog is king of the castle. So when this is very symmetrical, and it's hormonal as well. Look at all the mottling down here. So, I mean, I remember this one. Dr. Carroll put her on progesterone cream, had her do dry brushing and switch out her deodorant, and boom. I mean, I think this was 2 or 3 weeks later. It can go very fast, and dry brushing is very, very powerful. Very powerful.
We add to avoid a few food like coffee, soda, chocolate, because they all have, I don't know, xanthines. ¿Cómo se dice? How do you say that? Methylxanthinas. I don't know how to say that in English, but
Okay.
They contain a certain element that is inflammatory.
Oh, mycotoxins. Mycotoxins.
Oh, yeah. I
mold?
think that's it.
Yeah. Oh, I know what you're talking about. Absolutely. Oh, yeah. We got all kinds of things to get rid of, don't we?
yeah.
Oh, goodness. So here's dry brushing. This is just dry brushing and switching deodorant before and after. Powerful, right?
Yeah.
And I'll tell you what, I preached from the top of my lungs on the deodorant, because the dry brushing was a miracle, but the deodorant would just keep clogging and clogging that lymph. So if we didn't get them onto a good non-aluminum deodorant, it took longer, and if ever. So this was somebody who just did a great job over the course of a year, 17 to 18. And she was very faithful to diet, exercise, supplementation, dry brushing, deodorant, and switching from underwire bras and to wireless. And we cleared her up real nice. It was great. Here's another one.
Mm-hmm.
This was mostly visible veins here. That was my visible vein gal. But then we just isolated it to some lymph here. And we really did a great job of helping her.
Yeah.
Because we cooled that off. Sorry, my daughter has her dog here. And every time he walks in the room, I can't breathe. Okay, and then here is hormonal mottling at its finest. This is in the middle of a hot flash. This is only 5 minutes after this. Isn't that amazing?
Wow. Yeah, looks amazing.
Okay, so
A
she
hot
cleared
flash?
off.
What do you mean by hot flash?
Menopausal heat, hot flash.
El reflejo pasó.
Oh, okay,
pasó
okay,
blanco.
okay. Yeah.
This here is thyroid hormonal issue. It's more from the thyroid. It makes a necklace. It doesn't mean that the whole endocrine system isn't a mess, but this was primarily thyroid. It was discovered.
Okay.
And once she started to work on her thyroid, she lost the mottling. But look at this mottling. Isn't that crazy?
Looks very severe.
Amazing. So just thought I'd show you a couple of those. Oh, by the way,
Nice, thank you.
absolutely. Just a couple other things here. You guys are aware of the red glove, blood sugar imbalance. You know, the best test we have found to order for this pattern is fasting insulin, not glucose tolerance, but fasting insulin. That's
Okay.
the test. Yeah, if that helps you at all.
Yeah, thank you.
Chances are it's above 9. It's above 5.
Sometimes they have ¿cómo se dice?
¿Qué cosa?
Retención de líquidos
Oh.
o edema.
A nod, sir.
We're going to
We're
look for
gonna-
the word.
Go to the
Yeah.
Google Translator.
Kristin?
Yes, ma'am.
Yeah.
No, can you go back to the picture?
To the red glove, sure. Sure.
Yes. To the hands, to the red glove. Yes.
It's right
Is this
here.
a good? Is this a good picture? I mean, if you look at the head.
Yeah. I
Yes.
found it. Fluid retention.
Oh, sure, absolutely. Yeah. So really, we're not saying they have a sugar imbalance. We're just saying, hey, a lot of people whose hands look like this have a sugar
Yeah.
imbalance.
They
So you
get-
might want
yeah.
to check, you know, do and a glucose tolerance doesn't always do it. It's usually fasting insulin that gives it away here. And Monique, to answer your question, we're not taking an image of the head. The head is out of range.
Yeah.
And now I have people, this is not my image, because this is not the way to take this image. You don't want to see the opposite shoulder, and
No.
you don't want to cut it off. But it was an excellent example of the red glove, so I used
Yeah.
it. But the head is way too hot, and the head always looks hot in comparison to the rest of the body. It is the hottest part of the body unless there's some kind of injury or something going on, like the red glove here.
No,
Yeah.
okay.
Okay.
Okay? So yeah,
Yeah.
here's rosacea.
Oh yeah.
Rosacea. Her face looked perfect. It looked like yours, Daniela. But underneath that makeup, this is what was under there. And she didn't say a word. She didn't say a word to me until I started imaging her. And I went, okay, do you have rosacea? And she goes, I was wondering if you would notice that. And I'm like, do I notice? Do I notice? Okay, so enough stories. All right, so next time we get together, we're going to be talking more about breast thermography. We're going to really be focusing on it. We're also going to have Dr. Carol come on board and talk a little bit about how she interprets it, what they're looking for, and how you could image it. In the second half, I am working with Jim Sefrin from the Infraspection Institute to come and talk to us about the concepts of infrared imaging. So what is going on scientifically when a camera is converting photons to temperature differential? Woo, boom. And he and he teaches it so that we can understand it. He doesn't teach it like we're physics students in our 3rd year of college. He teaches it like we're thermographers who don't really know a lot about physics, and we're going to learn from him. And his name is Jim Seffron. And then the 3rd week, I've got some plans for us too. We're going to be doing more imaging, and we're going to talk about reflex sympathetic dystrophy, and we're going to be talking about complex regional pain syndrome and imaging that, which is a big deal. And it is something that also as a business person can be very profitable for you as a business person. Because instead of charging $400 for a full body, I charge $2,400 to image for RSD. And you'll see I earn every penny, but it's something that you can add to your business, and you can work with lawyers and attorneys on it. And it's something that you're doing an incredible service to. So I'm going to touch base on that as well.
Can I ask you, Kristin? It sounds very exciting, and then I'm thinking, is there a kind of book or written something, or can we read it?
No, nothing yet. I don't have time to write it. I only have time to talk about it. So you'll have these recordings.
Okay.
You'll have the recordings, but that's the best I can do right now. I don't have time to write a book. Maybe Francine and I could write a book together.
What do you say?
Maybe Francine and I can write a book. You know, she has that great book, Healthy Breasts.
Yeah.
Mm-hmm.
And I have the question to make. Wacht hoor. It's very difficult. If I can read it, I can. It's slower, and I can translate it, and so it's very difficult for me.
I understand.
I do speak English, but it's a little bit difficult.
Right.
So you were doing with the circle and the measuring.
Yeah.
And then you make the weet het, ik wil eens de vergelijking. Then you can see this report and 3 months before.
Yes. You want me to do that for you again?
Yes.
Okay, hang on. I'll do it for you again. Let me just open up the study.
And those things, it's easy to have it on a writing. So you can give an example for it. And
well, it's in the manual. It's in the Total Vision manual.
In our manual?
It is.
Which manual? Which we got?
The one that came with Dr. Carol with your camera. And I can arrange to get you another manual too.
I really don't have it.
Okay, I'll make sure you get it. You're a camera owner, you should have one. Okay.
Yeah, I think so.
Yeah.
I will look, but I think I don't know.
Okay, no worries. Okay, can y'all see this?
Mm-hmm.
Okay, let's do it with the breasts. All right.
Mm-hmm.
So what we're going to do is we have to pretend, because I don't have 2 studies. I can go into my other computer because I have 4,000 studies in there. Okay, so what we're going to do is, let's say that she has been doing so well on her breast that we want her to have that before and after to show to her doctor, to just show her so that she feels better, or so that she continues to engage in treatment.
Do you put it in the viewer or not?
No, do it from Capture. Okay. So all you do is you open up the study. Open up the study.
Sorry, Kristin. Perhaps I didn't tell you right, but I have a viewer. I have a viewer, and I want to use it like you did.
Okay. All right. I get what you're saying. Okay. So let's say that you start this imaging. You're going to go to viewer. Okay, let me stop share here. I know what you want now. Let me show you. We're going to go to my screen. Okay. All right. Let's start from scratch here. Let's say that my model is coming in and I want to image her breasts again. So I'm going to go to viewer. This is viewer I just pulled up.
Mhm.
Okay,
Uh-huh.
it's the green head down here in the bottom. Okay, I'm going to file and I'm going to open her up. And this is going to be her from, say, just pretend January. Okay, so there she is.
Mhm.
All right, I'm going to bring up, because now she's just coming for a breast follow-up. So here she is. Okay. And then I'm going to go into create a follow-up. I'm going to create a follow-up.
Oh, yeah,
Okay, right? You know how to do that. They come back a second time, you create
yeah.
a
Yeah, I
follow-up.
know, yeah.
Okay, you know that, but since I don't have a model here, I'm just going to go back to the same study just for the,
Uh-huh.
okay. I'm going to go, okay, thank you, breast. Thank you. Next. Oh, forget it. Hang on a second. Open existing. There we go. Sorry, I went fast there. All I'm doing is opening up an existing study and I'm clicking skip questionnaire so I don't have to look at the entire questionnaire.
Mhm.
Here we go. Now, let's say I just took these breast images, okay?
Mhm.
So let's say that this is April and this is January over here. So April's on the right and January's on the left, okay?
Yeah.
Fair enough?
Yeah.
So from the most recent, from today, I'm going to click File and Print Comparison Report. Bloop.
Okay.
And then it'll show me the date back in January. It's not here, but I'm just pretending. And I'm going to click Open. And it'll say, what do you want to compare? Do you want to compare head, neck, all of them? What? No, just breast.
Yep.
Okay.
Yep.
And I'm going to do it as a PDF. Click.
Yeah.
And there it is. Now,
Ah.
this would be January, and this would be, I'm sorry, this would be January, and this would be April, right here. The
Okay.
before and after.
Mhm. This
So
is
why-
very good.
Practice that, Monique, and bring it as homework next time. So go into two studies, one and then its follow-up. Somebody who wouldn't mind you showing the before and afters on our imaging here, on our training here, and just click on the most recent study, open it up, then go up, click on print comparison report, and find the one from you know, back in 2 months ago,
Yeah.
3 months ago, 2 years ago, whatever, and then
Okay.
do it.
Yeah.
And
Okay.
if the images have been taken correctly, it will show the differences. It will
Mhm.
show that her underarms are clearing.
Okay.
You know,
That's
it'll
very
show
nice.
that. But you have to make sure that you adjust the colors just right. So what you have to do is you have to go into that old one and you have to adjust these to match. So let's say the old one looks like that and the new one looks like this.
Mhm.
These are two identical studies here. These are two identical studies.
Uh-huh.
So I could easily trick somebody,
Yeah.
wrongly, right, not right, trick somebody into thinking that my supplement or my lymphatic drainage massage was working when really I just didn't have the color set right.
Yeah.
That's the whole point of this.
Yeah.
What if,
You're a fraud.
yeah, you're a complete total fraud then. That's why we have to be professional thermographers and do this right. What if I took it the second day, the second time around, I took it like this. And I said, oh, look at you back in January. What are you doing? You must not be taking my magic vitamins.
Oh.
Mhm.
Oh, I'll buy more, I'll buy more. So you have got to adjust these. And what you're adjusting for is you're adjusting for, you know, looking for the things that continue to stay the same. Usually the base of the carotid artery down here will stay the same. The heat underneath will usually stay the same. So you have to be looking for, this is, by the way, let me go here. So it's just the same because I'm not in the right one. Come on. There we go. So you're looking for ways to match this up. And when you get it matched just right, then you know what's changed. Look for the things that can remain the same.
So
And
you
then-
take the one in the viewer? No, not.
Yeah,
Which one is the viewer?
this is the viewer on the left. There's no way to capture anything. See?
yeah. No,
Viewer.
I know. That's the viewer. But and then you start with the new images and you make everything in the same, looking in the same. All right.
Right.
Thank you. That's
See, when I was in a hurry and I was busy, I would image side by side. But you can also just take all these images, then after the client leaves and you can think a little easier, you pull up the viewer and you put them side by side and you adjust them then. But I like to have conversations with my clients, and I'm sure Daniela does too, where you want to know right away so that you can have a conversation with your client.
Yeah.
So especially somebody who's a healthcare, a licensed healthcare provider, a doctor, a nurse, people that are allowed to talk to their clients more about the images can say, wow, look at you, you're doing so much better.
Mm-hmm.
Otherwise, you have to let them go home before you tell them that. And if you're not a licensed medical professional, you probably should. Don't try to talk to them about how much better their treatment is working. You're going to get yourself in hot water. So just take the images, let the doctor come back, but and tell them that they're doing better. But it's your job to make these images reflect what that interpretation is going to say. So if this person looks better 3 months later, but you've taken the images like this, the doctor is going to say they look so much better. But really, they're going to say, what, huh? Okay, does that make sense?
Yeah, thank you, Kristin. This is very, very good for me.
Good. I'm glad that you got something out of that.
Mhm.
Okay. All right. Is everybody ready to go to bed? To go to
Yes.
dinner?
I am really.
Anybody want to, Daniela, you want to stick around for anything?
Everything's perfect. I really love this session.